Remember the caspases, those are important. What is the dye used for apoptosis? Previous year question. Very good. It is the annexin 5 dye. On electrophoresis, apoptosis shows which pattern? Step ladder pattern. And necrosis shows smearing pattern. No issues with this, anybody? That's important. Question number 78. You and your friend went to a party. You don't like the food there. You both went out to have a roadside food. Okay. You both have decided to have fried rice. Fried rice at roadside. You both went home as it was 2 a.m. in that night and both need to attend college at 8 a.m. in the morning. You went to class, but your friend didn't come. He said that he's been vomiting whole night. Which organism is responsible for your friend's condition? Very good. After a history of Chinese fried rice intake, okay, if the patient develops vomiting, that is usually due to a case of Bacillus cereus food poisoning. Important is Staphylococcus aureus and Bacillus cereus, which strain? The emetic strain. That is one which causes vomiting. दोनों का incubation period same है. It is incubation period is 1 to 6 hours usually. Bacillus cereus का जो दूसरा strain होता है, that is the diarrhea strain which predominantly causes diarrhea. उसका incubation period होता है 8 to 16 hours. Okay, उसका incubation period होता है 8 to 16 hours usually. No issues with this. But in cases of Bacillus cereus, there is history of Chinese fried rice intake. In Staphylococcus aureus, there can be multiple other food history intake. It can be contaminated milk, contaminated water, contaminated food. But Chinese fried rice specifically is very, very characteristic of Bacillus cereus, that to the emetic strain. Important is Bacillus cereus jo hota hai, it is cultured on which agar? Very good. It is known as the MIPA agar. Bacillus cereus ke liye the agar which is used is known as the MIPA agar. Then next, this is which kind of diarrhea? Rice watery diarrhea. It is due to is seen in which condition? Cholera. Causative agent is Vibrio cholerae. Cultured on which media? TCBS media. It is cultured on TCBS media. Which kind of motility is seen with cholera? Darting motility. Transport media is used as Venkat Ramanan, Rama Krishnan, VR media. Okay, classical and untold varieties we have. Important is switching motility is seen with. Very good. Trichomoniasis. Please remember this. Okay? Oh, sorry. Then important. Darting motility is seen with Vibrio cholerae. Tumbling motility. Listeria. Then, sorry. Falling leaf-like motility is seen with Giardia lamblia. कम से कम ये 4 motility याद रख लो. Darting, Vibrio cholerae, falling leaf-like motility, Giardia lamblia, twitching motility, trichomoniasis, tumbling motility, listeria. ठीक है? चलो. No issues with this, anybody? Drug of choice for cholera. Doxycycline. Drug of choice for prophylaxis of cholera. Tetracycline. Shabash. No issues with this, anybody? Chalo. Question number 79 now. Fluoroacetate is a non-competitive inhibitor of aconitase enzyme. A non-competitive inhibitor of an enzyme will cause. There are 3 types of enzyme inhibition and 2 factors we need to see. First is called as Km. Km is nothing but which constant? Michaelis-Menten constant. Okay, Km is nothing but Michaelis-Menten constant. And Km will tell you about the substrate concentration. And second is Vmax, that is the maximum velocity of your reaction. Please remember. Now, usually, if there is a competitive inhibition, what do I mean by competitive? Okay, important is that is the substrate and the inhibitor. Both of them are similar. The substrate and the inhibitor, both of them are similar. And there is how many binding site on the enzyme? There is only single binding site on the enzyme. Therefore, both of them have to compete. Both of them have to compete. तो जिसका concentration ज़्यादा, उसका definitely जीतने का chance ज़्यादा. So definitely, if we want the reaction to occur, if we want to keep the Vmax same, if we want to keep the velocity of the reaction same, we have to increase the substrate concentration. And if we increase substrate concentration, that means Km will be increased. जिसको पता नहीं चल रहा, ऐसे याद रख लो. एक लड़की के पीछे 2 बंदे पड़े हुए हैं. ठीक है? अब किसके एक ही साइड है बाइंड होने के लिए, किसके जीतने के चांसेस ज्यादा? जो ज्यादा एफर्ट्स लेगा. ठीक है? So that's the basic important thing. So that is what is seen. Same applies for boys too. ठीक है? So that's important. Next is non-competitive inhibition. Non-competitive inhibition, usually here there are two sites usually. Okay, here there are two different sites definitely for binding of a substrate and binding of a inhibitor. ठीक है, तो अब कुछ भी कर लो, the velocity of the reaction is going to decrease. Why it is going to decrease? Because even if the substrate bind, the inhibitor has a different site to bind. Therefore, it will always and always and always bind. Does not matter. ठीक है? So that's the important thing. So if the inhibitor is going to bind any which ways, the velocity of the reaction is going to decrease. And if the velocity of reaction is going to decrease, कोई फायदा है क्या efforts लेके? नहीं है. So better keep the substrate concentration same. Therefore, the Km remains same. No issues with this, anybody? That's it. And uncompetitive inhibition, usually in uncompetitive inhibition, the substrate, the inhibitor only binds when there is a enzyme substrate complex. जब already एक complex बना हुआ है, तब जाके the inhibitor binds. He causes a transformational change usually, and that leads to kicking out of substrate finally. ठीक है? So that leads to decrease in the Vmax or maximum velocity of the reaction, and the substrate concentration is also going to decrease because the inhibitor will bind to the enzyme substrate complex, and then it will kick out the substrate from it. Therefore, the substrate concentration or Km is going to decrease. No issues with this. So remember, if Km is if Vmax is same and Km increases, that is which type of enzyme inhibition? Competitive. If Vmax decreases and Km remains same, that is non-competitive. And lastly, both decrease, that is uncompetitive. Linear Burke-Weaver plots usually, Line-Weaver-Burke plots usually. Now, if there is competition, क्या होता है? Crossing होती है. तो इससे easy और तरीका नहीं हो सकता. If both the lines are crossing each other, this is an example of competitive inhibition. That's the best way to identify. Okay? अगर दोनों, okay, both of them have started from a single point and both of them are going in different directions. Okay, that is a V is formed. That is an example of non-competitive inhibition finally. And both of them are parallel to each other. कोई किसी के साथ relation ही नहीं है. Then that is what is an example of uncompetitive inhibition. So if both the lines are crossing, competitive inhibition. They are forming a V shape, non-competitive inhibition. And if they are parallel to each other, uncompetitive inhibition. इससे easy तरीका हो ही नहीं सकता Line-Weaver Burke plots को अच्छे से याद रखने का. ठीक है? So that's it. Now please tell me, this fluoroacetate is a competitive or non-competitive inhibitor? Non-competitive inhibitor. What happens in non-competitive inhibitor? Vmax is going to decrease and the Km should remain same. What should be your answer? Answer should be option C. Decrease in Vmax will always and always be there because there is no competition only. दोनों के लिए bind करने के लिए अलग-अलग site है. Okay, so that's the basic thing. Question number 80. A 28-year-old man suffering from intractable vomiting is presented to a hospital and was unable to drink for the past 3 days. Okay, his blood analysis still shows normal blood glucose level. Which of the following process is mainly responsible for blood glucose maintenance in this patient? Now, usually within 2 to 4 hours after food, it is which state, anybody? 2 to 4 hours after food. So the 2 to 4 hours after food is the fed state. Okay, 12 to 18 hours without food. 20 to 18 hours without food is the fasting state. And usually more than 3 days without food. So usually it is the starvation state. Our patient is in starvation because for the last 3 days he has not eaten anything. What is the source of blood glucose in the fed state? What is the source of blood glucose in fed state? Blood में glucose आएगा कहाँ से? कहाँ से मतलब? डाइटरी ग्लूकोज ना भाई, खाना खा रहे हो मतलब डाइट से ही ग्लूकोज आएगा तुम्हारे ब्लड में. सो इन फेड स्टेट द सोर्स ऑफ ब्लड ग्लूकोज इज द डाइटरी ग्लूकोज. इन फास्टिंग स्टेट नाउ, डू यू हैव फूड नाउ इन योर बॉडी? नो. नाउ your body will only depend on the stored form of glucose, and stored form of glucose is known as glycogen. So in fasting state, the source of blood glucose or the glucose will come from glycogen. Glycogenolysis. So in fasting state, the source of blood glucose is glycogenolysis. And finally, in starvation, glycogen की भी तो कोई limit होगी. Glycogen will also get exhausted. It will be finished. Then after 3 days, what will happen? Body now wants to do effort. याद रख लो, जब तक तुम्हारे यहाँ तक पानी नहीं आता, तुम मेहनत करते हो क्या? नहीं करते हो तुम. ठीक है, तो इसीलिए इंपॉर्टेंट है. बॉडी भी ऐसी आलसी है, जब तक खाना मिल रहा है बाहर से तब तक उस पे, देन स्टोर्ड फॉर्म जो है उस पे, एंड जब वो भी खत्म होगा, देन इट स्टार्ट्स टू डू द हार्ड वर्क, देन इट एक्टिवेट्स द एनर्जी कंज्यूमिंग पाथवे, एंड दैट इज नथिंग एल्स बट gluconeogenesis. It start forming new glucose in the body which requires 6 ATPs. Okay, तो ये एनर्जी कहाँ से आएगी? ये 6 ATP जो चाहिए उसको, this energy will be given by lipolysis. What is lipolysis? Lipid or fat breakdown. When there is fat breakdown, that is beta oxidation of fatty acid, then definitely ATP will be released. That ATP will be used up by gluconeogenesis when non-carbohydrate compounds like lactate, pyruvate, propionic acid, glycerol, they will be converted back, or some glucogenic amino acids, they will be converted back to glucose by the process known as gluconeogenesis. And वहां से आएगा blood glucose. ठीक है? So that's the important thing. No issues with this, anybody? So that is important to be remembered. So in a starvation state, what is the source of blood glucose, guys? Answer should be option D, gluconeogenesis. Lipolysis is providing the energy. It is providing the substrate. Lipolysis cannot form glucose. That's important. हमने क्या पूछा है? Blood glucose कैसे आ रहा है उसका? Blood glucose maintain कैसा हो रहा है उसका? So blood glucose maintenance is by gluconeogenesis. Energy required for blood glucose or gluconeogenesis is given by lipolysis. Okay. Next, question number 81. An adolescent male patient came with pain in calf muscles on exercise. If the patient has pain on doing exercise, that is called as exercise intolerance. Very good. The patient is not able to do exercise. Okay. On biopsy, excessive amount of glycogen was found to be present in the muscle. Which was the glycogen storage disease when there was collection of glycogen inside the muscle? Type 5 glycogen storage disease known as McArdle's disease. And McArdle's disease usually occurs in, what is the most likely enzyme deficiency? Muscle glycogen phosphorylase, also known as myophosphorylase. Important is most common glycogen storage disease or most common GSD in children, one year keys. But most common glycogen storage disease in adults or in adolescents, then your answer should be McArdle's disease. Then your answer should be McArdle's disease. Please remember, here the patient will only have pain or exercise intolerance. That will be the only feature, and muscle biopsy showing glycogen accumulation. Okay, no issues with this, anybody? Rest we have discussed already. Question number 82. A 3-year-old male child presents with bloating, again gas formation, diarrhea, vomiting after ingestion of dairy products. Examination reveals hepatomegaly and there are bilateral lenticular opacities. Okay, opacities in the lens are nothing else but cataract. Shabash. Opacities in the lens are nothing else but cataract. They are talking about some bilateral cataract in this child. Lab examination shows normal blood glucose levels by GOD-POD assay, but positive Benedict's test in urine. Benedict's test tells you about reducing sugars in urine. Reducing sugars are sugars like glucose, fructose, galactose in urine. Okay, important. Even mannose. Sucrose and trehalose are non-reducing sugars. Okay, what is the likely deficiency? What is your provisional diagnosis? Provisional diagnosis is right, barabar. It is a case of galactosemia. Why it is a case of galactosemia? Because after ingestion of dairy products contain lactose, and lactose is nothing but glucose plus galactose. So after ingestion of galactose, the patient is having features of malabsorption like bloating, diarrhea, and vomiting. So he is not able to absorb galactose. Why? Because the enzyme responsible for galactose breakdown or metabolism are absent or deficient in this patient. Therefore, the patient is developing galactosemia. The rate limiting enzyme of galactose metabolism is GAL1 put, that is galactose 1 phosphate uridyl transferase. And the first enzyme which is there is known as galactokinase. Now there can be deficiency of both the enzymes. Important is if there is deficiency of galactokinase, that is called as classical galactosemia or non-classical galactosemia. That is a non-classical, or we can call it as the minor type of galactosemia. Why minor type? Because if there is galactokinase deficiency, the patient will only and only develop cataract. No other features of malabsorption will be there. Only cataract. Which kind of cataract develops? There is a classical oil drop cataract, as you can see in the image. ठीक है, this is the classical. वो orange वाली image हमेशा नहीं आएगी, मैं बता रहा हूँ. ठीक है, there's a classical oil drop cataract which develops in the patient. So only cataract develops, so galactokinase deficiency, that is minor type of galactosemia. But along with cataract, if they say the patient is also having malabsorption wala features like diarrhea, vomiting, nausea, bloating, flatulence, everything like that, then it should be a case of classical galactosemia or the major type of galactosemia. And classical or major type of galactosemia is due to deficiency of the rate limiting enzyme itself, that is known as GAL1 put, that is galactose 1 phosphate uridyl transferase. यहाँ पे GAL1 put answer क्यों? Because our patient was having features of malabsorption syndrome also. No issues with this. Avoid dairy products is the treatment. Galactosemia is the absolute contraindication of breastfeeding. Second absolute contraindication of breastfeeding from child is lactose intolerance. Third absolute contraindication from mother's side is maternal chemo or radiotherapy. If a mother is undergoing maternal chemo or radiotherapy. And fourth, it can be herpes infection involving the nipple. Okay, please remember, involving the nipple. If there is herpes infection involving the breast, not the nipple, it is not a contraindication, absolute contraindication. It can be relative. Active untreated TB, relative. HIV positive female, relative. Okay, absolute are only three. And the fourth one is herpes involving nipple. Okay. Question number 83. A 10-month-old child had normal growth and development for the first few months, but the growth started deteriorating. Kam hone lagi growth gradually, along with symptoms such as deafness, blindness, atrophied muscle, inability to swallow, that is dysphagia, and seizures. A cherry red macula was noticed in both the eyes during fundus examination. Globocytes and gangliocytes were elevated. What is the most accurate diagnosis? What is your diagnosis? Very good. So important is, ठीक है, in a case of lipid storage diseases, जल्दी से बताओ enzyme deficiency. Most common lipid storage disease is known as Gaucher's disease. Enzyme deficiency is beta glucosidase, also known as beta glucocerebrosidase, also known as beta glucosyl ceramidase. जो अगला क्वेश्चन होगा. Next is Tay-Sachs disease. Tay-Sachs disease is due to deficiency of hexosaminidase. A या B? A. Okay. Next is Niemann-Pick's disease due to deficiency of enzyme known as sphingomyelinase. Okay, sphingomyelinase. Next, Sandhoff's disease due to deficiency of shabash hexosaminidase A and B. Please remember. So please remember hexosaminidase A and B दोनों की deficiency होती है patient में. ठीक है, therefore this is a more severe condition in the patient. Next, Krabbe's disease, deficiency of beta galactosidase, also known as beta galactocerebrosidase, also can be called as beta galactosyl ceramidase. Next important is Fabry's disease due to deficiency of alpha galactosidase, also known as alpha galactocerebrosidase, also can be called as alpha galactosyl ceramidase. Okay, and last is aryl sulfatase A deficiency leads to metachromatic leukodystrophy. Then all sphingolipidosis can cause mental retardation except Gaucher's disease. तुम बोलोगे सर Gaucher's type 2 जो बहुत रेयर है उसमें होता है. हाँ उसमें होता है, बट दैट इज वेरी वेरी रेयर. ठीक है, वेरी वेरी रेयर. तो ये इजी तरीका है याद रखने का. यूजुअली रेयर कंडीशन का तुम्हें डायग्नोसिस कोई नहीं देने वाला. तो ऑल sphingolipidosis can cause mental retardation or intellectual disability except Gaucher's disease. All sphingolipidosis can lead to cherry red spot except Tay-Sachs में तो दिखता है भाई, except Gaucher's disease and Fabry's disease. टे सैक्स में तो कैरेक्टरिस्टिक फीचर है चेरियर स्पॉट, मैं बोल रहा हूँ कि इसमें नहीं दिखता है. Then all sphingolipidosis leads to hepatosplenomegaly except, ये एक्सेप्शन है, ठीक है, except Fabry's disease, and second one is Krabbe's disease. This will make your diagnosis very, very easier. Last, all sphingolipidosis follows autosomal recessive pattern of inheritance except Fabry's disease. Hunter's is a mucopolysaccharidosis. It is not a lipid storage disease. Fabry's disease, which follows X-linked recessive pattern of inheritance. X-linked recessive pattern of inheritance. Matlab, disease will only and only be seen in with sex males. Females will only be carriers of the disease. Important is, याद रखना, in biochemistry, most of the diseases are autosomal recessive, except few. So all mucopolysaccharidosis are autosomal recessive except type 2 known as Hunter's disease, which is X-linked recessive. All lipid storage diseases are autosomal recessive except Fabry's disease, which is again X-linked recessive. Okay? No issues with this. So all sphingolipidosis can cause mental retardation except Gaucher's disease. All sphingolipidosis can lead to cherry red spot except Gaucher's disease and Fabry's disease. All sphingolipidosis leads to hepatosplenomegaly except Fabry's disease and Krabbe's disease. All sphingolipidosis follows autosomal recessive pattern of inheritance except which follows X-linked recessive pattern of inheritance. Ab, definitely as they mention that the patient is having cherry red macula, what I can rule out easily will be Gaucher's disease and Fabry's disease, because in both these conditions it is not seen. Next, I'm left with Krabbe's disease. Important is, if I talk about Krabbe's disease, definitely the patient will have atrophied muscles or inability to swallow. But important is, again, in Krabbe's disease, we will not see other features. The predominant features which are seen in Krabbe's disease are CNS features only. Mainly, we will see CNS features in cases of Krabbe's disease. Reason is beta galactocerebroside is only present in CNS. Glucocerebroside is present outside CNS. Galactocerebroside is present inside CNS. That's the basic reason for it. Okay? So that's the reason. So here answer should be Sandhoff's disease, which is a very common lipid storage disease. It is very severe. Important is because of deficiency of hexosaminidase A as well as hexosaminidase B. दोनों की deficiency की वजह से होता है, and therefore there will be a lot of collection of globocytes as well as gangliocytes in the patient. Even if Tay-Sachs was there in the option, I would have marked it as Sandhoff's because Tay-Sachs is only a milder form of Sandhoff's. Okay, Tay-Sachs में क्या दिखता है? Only hepatosplenomegaly along with cherry red spot and maybe mental retardation, nothing else. But यहाँ पे you can see there is deafness also, there is blindness also, atrophied muscle also, along with seizures also in the patient. Okay, so that means multiple organs have been involved. So it is a case of Sandhoff's disease. Question number 84. A patient presented with voracious appetite, बहुत ज़्यादा खाना खा रहा है. Okay, due to that there is obesity in the child. There is short stature also. There is hypogonadism. Okay, and mental disability. That is intellectual disability. Karyotype analysis shows a small deletion on proximal long arm of chromosome number 15. Physician suspected it to be a case of genomic imprinting. ये मैंने पैथो में अच्छे से समझाया. Genomic imprinting is nothing but gene silencing, and gene silencing is nothing else but gene inactivation. मतलब एक जीन क्या हो जाती है तुम्हारी डिलीट और दूसरी जीन क्या हो जाती है inactivate या silenced. ठीक है, so that's the reason why patient develops the disease. Which disease is caused by genomic imprinting? So it is easy. Option A, Prader-Willi syndrome. The another disease which can be caused by genomic imprinting, gene silencing on chromosome number 15. ये कीवर्ड था जिनको नहीं पता कि Prader-Willi is due to chromosome number 15. Chromosome number 15 is the keyword for the disease. कुछ और देखने की जरूरत नहीं थी किसी को. Okay, so important is Prader-Willi syndrome and second is Angelman syndrome. Important, अब ये तो याद रखा होगा मोस्ट लाइकली Prader-Willi syndrome में किसकी जीन डिलीट होती है? पप्पा की जीन डिलीट हो जाती है और मम्मा की जीन क्या हो जाती है? साइलेंस्ड हो जाती है. पप्पा की जीन डिलीट और मम्मा की जीन साइलेंस. सो पी फॉर पप्पा, पी फॉर Prader-Willi. नेक्स्ट इज एंजल कौन होता है तुम्हारी लाइफ में? अम्मा. तो अम्मा की जीन क्या हो जाती है यहाँ पे? डिलीट इन एंजलमैन सिंड्रोम. एंड पापा की जीन क्या हो जाएगी? silenced. Okay, that is what is Angelman syndrome. Both are due to chromosome number 15 mutations. No issues with this, anybody? Both are examples of genomic imprinting or gene silencing. Marfan syndrome is also due to chromosome number 15. Okay, important. What are the features of Marfan syndrome? It is due to chromosome number 15. Which gene mutation? Fibrillin 1 gene mutation. Okay. There is flat feet. That is nothing else but pes planus, it is called as. Long, slender fingers. These are called as arachnodactyly. Long, slender fingers known as arachnodactyly. Then pneumothorax in the patient due to formation of bleps or bullae, and they will rupture, causing pneumothorax in the patient. Then the patient will have regurgitation, that is mitral and tricuspid regurgitation will develop in the patient. The patient will have aortic root dilatation as well. There will be aortic dissection there as well as aortic rupture. Okay, as well. Important. The patient will have myopic ectopia lentis. Ectopia lentis is nothing but lens subluxation or dislocation. Most common site for lens dislocation is superotemporal. Rather, Marfan syndrome is the most common cause of lens dislocation or ectopia lentis. Please remember. Then there will be hyperextensible joints. कैसे भी मोड़ लो, joints move हो जाएंगे. Please remember. There will be a chest deformity, which is inward curvature of chest, known as pectus excavatum. The patient will have a tall, thin stature. लंबा सा patient, पतला सा होगा. His arm span will be more than his height as well. Okay, so that is what is known as Marfanoid habitus. So these are the usual features of Marfan syndrome. No issues with this, anybody? Next is ये question में आ चुका है. EDS, Ehlers-Danlos syndrome. Ehlers-Danlos syndrome of multiple types, but usually more commonly it is due to collagen. कौन सा defect? One defect. It is more commonly is due to collagen one defect. Collagen one defect से osteogenesis imperfecta भी होता है. Okay, but in osteogenesis imperfecta, what is the classical triad? Patient will have recurrent and multiple bony fractures. Second, the patient will have which kind of sclera? Blue sclera. And third, the patient will have sensory neural hearing loss. But in case of Ehlers-Danlos syndrome, due to collagen one defect, the patient will have joint hyperextensibility or hypermobility. Okay, this patient will have skin elasticity. Okay, whereas there will be tissue fragility. That means easily it can bleed. Okay, so these are Ehlers-Danlos syndrome. Question number 85. All of the following are contents of the structure zoomed or encircled in green except. What is this structure zoomed? It is a carotid covering known as carotid sheath. And ये question cover किया था. Which structure are present inside the carotid sheath? Anybody? Carotid sheath है. So which structure will definitely be there? Carotid artery. उसके साथ साथ कौन सी vein होगी? Internal jugular vein. Now we are left with nerves usually. ठीक है? Definitely we know the 10th cranial nerve or the vagus nerve is also a part of the carotid sheath. Whereas the 9th cranial nerve which is there. Okay, the 9th cranial nerve, as you can see over here. This is the 9th cranial nerve. This is coming over here. It enters into the carotid sheath and it exits immediately. But yes, it is a part of at least the carotid sheath. कम से कम आई तो सही अंदर. Whereas sympathetic trunk which is there, this is what is the sympathetic chain. Sympathetic chain is never a part of carotid sheath. So exception will be the sympathetic chain. Okay. Please remember, exception will be the sympathetic chain. Sympathetic chain is never a part of the carotid sheath. Please remember that. Even ansa cervicalis, that is the cervical plexus, is not a part of the carotid sheath. Carotid sheath में कौन सी artery? Carotid artery. कौन सी vein? Internal jugular vein. कौन सी दो nerve? First is 10th cranial nerve known as vagus nerve. कौन सी दूसरी nerve? 9th cranial nerve known as glossopharyngeal nerve, which is not a part sympathetic chain. And second, ansa cervicalis. ठीक है? Question number 86. An 8-year-old boy was referred with TLC of 84,600 cells per microliter. Flow cytometry revealed CD34 plus or CD34 positive lymphoblast, for which cyclophosphamide was started. On the same day, patient had anuria and there were seizures. Which of the following is not likely associated finding? What is your provisional diagnosis, guys? Patient was having a TLC count of 84,600. Normal TLC count is total leukocyte count 4 to 11,000. ठीक है, यहाँ इतना ज्यादा. That means it is a case of WBC malignancy. WBC malignancy is known as leukemia. बच्चे में leukemia कौन सा होता है? ALL. For ALL, definitely valve therapy started now. I hope all of you are quite aware. V for vincristine. A for adriamycin. L for L-asparaginase. P for prednisolone. These are the valve chemotherapy regime which is started in ALL. Important is, after chemotherapy, what is going to happen now? कैंसरस सेल्स जो होता है, प्लीज टेल मी, कैंसरस सेल्स में न्यूक्लियर मटेरियल ज्यादा होता है या कम होता है? So definitely in cancerous cells, the nuclear material like the DNA, RNA, vagara will be more. If the nuclear material is more, when it will be broken down, please remember the nuclear material like DNA or RNA, when it will be broken down, it will lead to formation of purines and pyrimidines. And finally from purines, what will be formed? Uric acid. So there will be excess amount of uric acid in the patient after chemotherapy. Why? Because chemotherapy will kill this all these cancerous cells. Once it kills all the cancerous cells, this nuclear material DNA RNA will be released and that will be converted to purines and pyrimidines. When purines will be further broken down, they will form the end product known as uric acid. That is called as hyperuricemia. Along with that, it will also cause cell के अंदर क्या ज्यादा होता है, पोटेशियम या सोडियम? Potassium. So when the cells are destroyed, what will be released? Potassium. That will cause hyperkalemia in the patient. Cell के अंदर और क्या ज्यादा होता है? Phosphate. So when cell will be broken down, there will be hyperphosphatemia in the patient. Okay. Now this excess of phosphate, it will bind with, इसको प्यारा कौन है phosphate को? Calcium. So this excess of phosphate will bind with calcium and it will deposit at various sites usually. Therefore, the level of serum calcium will decrease. So that will cause hypocalcemia. Baki sub will increase. Only calcium levels are going to decrease. And this condition is nothing else but your favorite question of your examiner. Answer is nothing but tumor lysis syndrome. So when chemotherapy is given for any cancer, that causes tumor lysis syndrome, that leads to hyperuricemia, hyperkalemia, hyperphosphatemia, but hypocalcemia, that is the exception. Please remember that. Okay? So for tumor lysis syndrome, as there will be hyperuricemia, chemotherapy start करने से पहले कौन सी ड्रग दी जाती है? शाबाश, रास ब्यूरी केस. ओके, जो गाउट में भी यूज हो रही थी ना, that same drug is given over here. ठीक है? No issues with this, anybody? Question number 87. A research scholar in AIMS, New Delhi, is working on antiarrhythmic drugs. Okay, he mainly targets the excitable tissues of the heart, that is your conducting system of heart. SA node, AV node, bundle of his, right and left bundle branches, and Purkinje fibers. He records the action potential of the graph throughout his experiment. On administering a drug, he observed that slope of phase 0 is decreased and the duration of action potential is increased. The drug is expected to act on which channels? Now there are 4 phases of action potential. Normally the cell, it is in the resting membrane potential. What is the normal resting membrane potential of a cardiac muscle fiber? Resting membrane potential कम से कम रट लो. It is minus 90 millivolt. For a skeletal muscle fiber, it is minus 85 millivolt. Please remember, for neurons, it is minus 70 millivolt. Okay. For smooth muscle cells, it is minus 50 millivolt. For rods and cones, that is your photoreceptors, it is around minus 40 millivolts usually. ठीक है? तो यहाँ पे resting membrane potential is minus 90 millivolt. Now what is going to happen in phase 0? क्या हो जाएगा सबसे पहले? As soon as the stimulus comes, ठीक है, just ही signal मिला, immediately the sodium channels are going to open या close? Open. And as the sodium channels open, a lot of sodium is going to come inside the cell. Sodium is positive or negative? Positive. So the cell from negative, it will start becoming positive because a lot of positive ions are coming inside the cell. Therefore, the cell will start becoming positive and it will go up till plus threshold कितना होता है? 35 millivolt. Okay, once it reaches over here, the phase 0 is done. Now at plus 35 millivolts, the sodium channels are going to close. This was phase 0. After this, what is going to happen now? In phase 1, now what is going to happen? The potassium channels are going to open. And as the potassium channels open, the potassium is going outside the cell or inside the cell? The potassium will be going outside the cell. Potassium is positive or negative ion? Positive. So So if positive ion is going outside the cell will again start becoming negative. So phase 1 mein the cell starts becoming negative. But immediately what happens in phase 2? The voltage gated calcium channels will open, and as the voltage gated calcium channels will open, calcium will enter inside the cell or outside the cell. Calcium influx hoga, calcium will start entering inside the cell. Calcium is positive and negative? पॉजिटिव. ठीक है, यहाँ पोटेशियम का भी चल रहा है, पोटेशियम अभी भी ओपन है, पोटेशियम अभी भी बाहर जा रहा है, बट कैल्शियम बहुत ज्यादा अंदर भी आ रहा है. ठीक है, तो इक्वल प्रोपोर्शन में चल रहा है. नाउ कैल्शियम इज पॉजिटिव, सो एज कैल्शियम इज पॉजिटिव, potassium is also positive. One positive ion is going outside, another positive ion is going inside. Therefore, the membrane potential will be maintained at a plateau. That is phase 2. And lastly, finally, what is going to happen now in phase 3? क्या हो जाएगा? The calcium channels will now close. Only open will be the potassium channels. As the potassium channels are still open, potassium is going outside the cell. Potassium is positive ion. Positive ion going outside the cell. The cell will start becoming negative. It will come again towards the resting membrane potential, which is minus 90 millivolt. ठीक है? But as it comes towards the minus 90 millivolt, पहले तो वो एक dip लेगा and then it comes to normal. This dip is nothing but hyperpolarization. This dip is nothing but hyperpolarization. और ये जो हुआ phase 0 में, when it became electropositive, that was called as depolarization. समझ गए? No issues with this anybody? So phase 0 is due to opening of sodium channels. Phase 1 is due to opening of potassium channels. Phase 2 is due to opening of potassium channels as well as opening of calcium channels. Phase 3 is due to opening of potassium channels. And phase 4 is due to opening of potassium channels again. Hyperpolarization हो रहा है ना? That is what is seen. Now phase 0 पे काम कर रही है drug. मतलब it is acting on which channels? Sodium channel. It is blocking the sodium channels. If sodium channels are blocked, definitely will the signal be conducted further? एक सेल से दूसरे इसमें सिग्नल जाएगा क्या? नहीं जाएगा. अगर सिग्नल ही नहीं जाएगा तो अरिथमिया होगा क्या? वही तो चाहिए हमें. ठीक है? So definitely, if the slope of phase 0 is decreased, that means the sodium channels have been blocked. इसीलिए slope of phase 0 is very slow, and therefore the duration of action potential is also increased. क्योंकि phase 0 में बहुत ज़्यादा time लग रहा है, क्योंकि the sodium channels have been blocked. So it is nothing else but blocking of the sodium channel. That is class 1 antiarrhythmic drug. Class 2 antiarrhythmic drugs are beta blockers. Class 3 are potassium channel blockers. Class 4 are calcium channel blockers, and class 5 are others usually. Longest antiarrhythmic drug, amiodarone. Shortest acting antiarrhythmic drug, adenosine. Adenosine is the drug of choice for PSVT. Amiodarone is the drug of choice for chemical cardioversion usually. Okay, whenever we need a chemical cardioversion, like in cases of stable ventricular tachycardia, arrhythmias और सीजर्स के घर जाओ और इनके ड्रग ऑफ चॉइस एक पन्ने पे चिपका के सामने लगाओ. तुम्हें डायग्नोसिस बन जाएगा. अगर तुम्हें ड्रग नहीं पता बहुत गड़बड़ होगी, याद रख लेना. वेंट्रिकुलर फिब्रिलेशन, वेंट्रिकुलर टैकीकार्डिया का इजी है डायग्नोसिस ईसीजी से बनाना, बट अगर ड्रग ही नहीं पता तो आंसर क्या करोगे? तो इंपॉर्टेंट इज प्लीज डू दैट प्रॉपर्ली. नेक्स्ट इज क्वेश्चन नंबर 88. सरकारी क्वेश्चन. Inhibitor of complex 3 electron transport chain are all except. So we know over here complex 1 inhibitors are usually they contain one in their name, that is rotenone and phenobarbital. One है ना उनके नाम में. So any one which contains one in its name is a complex 1 inhibitor, rotenone and phenobarbital. Then complex 2 inhibitor is malonate, also known as malonyl coenzyme A. Next, third is complex 3 inhibitors. These are fenformin. Along with that, British anti-lewisite. Along with that, anti-mycin. Along with that, dimer-caprol. So these are the 4 complex 3 inhibitors: fenformin, BAL, antimycin, and dimer-caprol. Complex 4 inhibitor, ये सरकारी है. It is cyanide. Okay, this question has been repeated at least, if I must say, 5 times in the exam. 5 times in the exam. Yes, NEET-PG plus FMGE I'm saying. Okay, so complex 4 inhibitor is cyanide. Other complex 4 inhibitors are carbon monoxide and hydrogen sulfide. ठीक है, and complex 5 inhibitor is oligomycin. Atractyloside जो होता है ना, it is a inhibitor of ADP, ATP, translocase. It is the inhibitor of ADP ATP translocase. Because ETC से क्या बनता है? ATP. Where? In the mitochondria. That ATP should be thrown out now. So for that we have this ADP ATP translocase. So that will be inhibited by a drug known as atractylo. Okay. So jaldi se complex 1 inhibitors, rotenone and phenobarbital. Complex 2, malonate. Complex 3, fenformin, bal, antimycin, dimercaprol. Complex 4, carbon monoxide, cyanide, hydrogen sulfide. Complex 5, oligomycin. ADP ATP translocase, atractyloside. So here you answer antimycin, bal, dimercaprol. All are complex 3 inhibitors except malonate, which is a complex 2 inhibitor. Question number 89. A patient presents with the triad of thrombocytopenia, eczema, and recurrent infection. Which of the following statement is correct regarding the given condition except? So you need to find the incorrect statement. Option A says it is due to defect in VASP gene. है क्या diagnosis? पहले diagnosis बता. Very good. The diagnosis is nothing else but Wiskott-Aldrich syndrome. And Wiskott-Aldrich syndrome can be remembered by the classical mnemonic waiter. ठीक है. WA goes for Wiskott-Aldrich syndrome. I goes for immunodeficiency. I goes for immunodeficiency. T goes for thrombocytopenia, that is decreased platelet count. E goes for eczema. E goes for eczema. And R goes for recurrent infections. Due to immunodeficiency, the patient has recurrent infection. Okay, so it is due to VASP gene mutation. Please remember. Okay, IgM levels will be low. That's true. Because the patient is immunocompromised. Okay. Next is hematopoietic stem cell transplantation is the treatment. True. Autosomal recessive pattern of inheritance. No, it is X-linked recessive pattern of inheritance. Therefore, it is only seen in males. Females are just carriers for this disease. Okay. So याद रखना. तुम बोलोगे सर सबके pattern of inheritance नहीं. Autosomal dominant, X-linked recessive. More important to be remembered. More important to be remembered are these. Autosomal recessive तो पूरी दुनिया भरी पड़ी है. बहुत सारे disease autosomal recessive ही होते हैं. ठीक है. But these two are exceptions always. XLR and AD. These are to be remembered. ठीक है. No issues with this. This is a platelet defect or platelet deficiency known as Wiskott-Aldrich syndrome in the patient. Question number 90. An old age male comes to your OPD with complaints of weight loss. Despite of overeating, continuous thirst sensation is there and increased urinary frequency. That is nothing else but polyuria in the patient. क्या लग रहा है patient में? ज़्यादा खाता है polyphagia, increased thirst sensation, polydipsia, along with increased urinary frequency, polyuria. Very good. You are suspecting diabetes mellitus in this patient. Therefore, you advised him glucose tolerance test. Glucose is absorbed in the intestine by. Now, when you eat food, guys, okay, when you eat food, it is broken down into the simplest form, and that is nothing but glucose. Now, this glucose is absorbed in the intestinal cell with the help of a transporter known as SGLT1. SGLT is nothing but sodium dependent glucose transporter 1. SGLT1 will absorb glucose, but along with that, it will also absorb sodium inside the cell. Sympod या antipod? Sympod या antipod? Sympod, because both of them are brought inside the cell, same direction. Now, if there is a lot of sodium inside the cell, क्या हो जाएगा? Lot of water can come inside the cell. Cell will undergo swelling and that can cause rupture. So can we keep a lot of sodium inside the cell? No. So we need to kick out the sodium outside again. And that is done by a pump known as sodium potassium ATPase pump definitely. क्या करेगा sodium potassium ATPase pump? It will throw sodium outside and bring potassium inside. But for this, it requires ATP. That means it requires energy for the same. How much is the coupling ratio? Sodium potassium ATPase pump. कितने sodium बाहर कितने potassium? 3:2 usually. Okay. And this glucose which has been absorbed in the intestinal cell, जितना intestinal cell को चाहिए उतना वो रखेगा, and rest will be sent into the blood via a receptor on the basolateral membrane known as GLUT2 receptors. Please remember this. ठीक है? No issues with this. Now we have two receptors. Absorption is taken place by SGLT1. ठीक है? SGLT1 is facilitated diffusion, simple diffusion, primary active, secondary active. So important is, please remember, SGLT1, is it using any type of ATP? It is not using any type of ATP. Okay. Therefore, it cannot be primary active transport. But it is dependent on a mechanism which is using ATP. कौन सा? Sodium potassium ATP is formed. Therefore, it is an example of secondary active transport. It is nothing but the SGLT. SGLT1 is located in intestine and kidneys, and it is responsible for absorption of glucose and galactose, whereas SGLT2 is only located in kidneys and it is only responsible for reabsorption of glucose. Please remember. Okay, whereas GLUT is an example of glucose transporters are an example of facilitated diffusion. Simple matlab, no need of any transporter. It will cross directly the membrane. Facilitated diffusion, किसी की मदद, किसी का सहारा चाहिए. Okay, so that is what is a facilitated diffusion. That is glucose. No issues with this, anybody? Sodium potassium active, sodium potassium pump will be example of primary active transport because it's itself using ATP. Question number 91. A female accuses a politician of rape. Police goes to the crime scene after investigation finds some yellow colored starch like stains. After examination of samples under microscope, crystals of brown color with rhombic shape was seen. These crystals are formed in which test? Now important, if I talk about the blood stains, there are two tests for blood stains. First is usually when we add a Takayama's reagent, it will give us pink feathery crystals. Which crystals are these? Pink feathery hemochromogen crystals. Okay, that is known as the Takayama test. And if we add the Teekman's reagent, we will get brown rhombic crystals. These are brown rhombic. Which crystals, anybody? Hemin crystals. Okay, these are seen in the Teekman's test. Please remember this. Next, these are the blood stain wala test. Can anybody tell me species identification के लिए which is the test? Very good. For species identification कि ये खून इंसान का है या जानवर का, to assess what species of blood it is known as the precipitin test. Previous year question, it is known as the precipitin test. Next important, seminal stain के लिए test. As there is a history of rape and there is a starch like stain, usually it is the semen usually. Okay, so seminal stain mein if I add the Barberio's reagent, it will show which kind of crystals? Yellow needle shaped crystals. Which crystals? It will show spermine picrate, yellow needle shaped crystals. And if I add the Florence reagent, it will show which kind of crystals? Brown rhombic crystals. Okay, brown rhombic crystals. Which crystals? Choline crystals. Easy है, Barberio's spermine, choline Florence. Okay? Important is, what is the answer? These crystals are formed in which test now? Yellow color starch-like stains, crystals of brown color, rhombic shape. How Barberio's it can be? Barberio's is very clear cut. Yellow needle-shaped crystals. Did I mention needle-shaped crystals? No, it is rhombic crystals. Basic है. बस Barberio's ही करते हो क्या यार? Seminal stains के लिए. So please remember that's important. It is the Florence test. Answer for this test. Okay. Next question number 92. For safe disposal of biomedical waste, which of the following method is not appropriate? They are asking guys. Option A says discarded medicine should be incinerated. Yes. Discarded medicines. पहले तो color coded categories बताओ चार. Yellow, red, white and blue. Yellow is a bag. Red is a bag. White is a translucent container. Blue is a box. और blue is not there in option. तो क्या करोगे? Cardboard box can also be used instead of a blue container. Please remember. Now yellow waste में, yellow bag में क्या क्या waste जाता है? जल्दी से. It goes the human anatomical waste. Then we will also give the animal waste. Then microbiological waste, biotechnological waste. That is all lab waste. Next, apart from that, cytotoxic and discarded medicines. Apart from that, any soiled waste. That means any waste which is contaminated with your body fluids, sputum, saliva, semen, urine, anything like that. Okay? Soiled waste, cotton swabs, gauze pieces, dressing pads, beddings, linens, mattresses, everything. Okay? Apart from that, liquid waste. Okay? Chemical waste. All of this goes into the yellow category. No issues with this. रेड में क्या जाता है? रिसाइक्लेबल्स, रिसाइक्लेबल्स राइट, rubbers and plastics. Okay, recyclables like rubbers and plastics. White translucent container में we dispose of sharps usually, and blue container में glass and metals, glass and metals. General waste black bag. Very good. तो wrappers वगैरह जो होते हैं वो black bag में जाते हैं. ठीक है? Now what is the method of disposal for the yellow bag? Incineration. Temperature more than 1200 degree Celsius. Please remember. Red bag के लिए method of disposal. Autoclaving, hydrowaving, autoclaving, hydroclaving, microwaving. उसके बाद क्या? Recycling या फिर road making. ठीक है? Next, white sharps. Again, autoclaving, hydroclaving, microwaving. Disinfect हो गए. अब shredding, and it will go into land pits or sharp pits. Okay? Next important, blue box usually, glass or metalware, autoclaving, hydroclaving, microwaving. Disinfect हो गया. उसके बाद क्या? Recycling. ठीक है? So definitely now let's come back to this. Discarded medicine should be incinerated. Yes, because they go into yellow bag, they will undergo incineration. Liquid waste should be disposed at site by chemical treatment. Yes, after chemical treatment, when it is decontaminated, can be drained easily. Used and unused sharp should be recycled. No. Used and unused sharp, it goes for shredding, and from shredding, usually it goes into the landfills or the sharp pits usually. Okay? So, human anatomical waste should be buried deep in rural areas. Yes, usually placenta. In rural areas, do we have incineration? No. So, in that areas, it is better to bury these human anatomical organs like placenta or amputated limb. Okay? Haan. Recycle important is, अगर मैं इसमें देखो ऑप्शंस में, recycling is not preferred method of disposal. Preferred method of disposal is sharp pits और landfills. तुम बहुत सारी चीजें रोड मेकिंग में भी जाती है. रोड मेकिंग इज अ रीसेंट वन, बट यूजुअली रेड बैग का जो वेस्ट होता है वो रिसाइकलिंग में पहले जाता था, अभी रोड मेकिंग में जाने लगा. ठीक है? So that's the important thing. Even if you try to disinfect it, there are chances it will get contaminated. That's the reason why usually we don't try to handle sharps. Okay, we try to send it to landfills directly. No issues with this. Question number 93. All of the following are true regarding routine immunization except option A says all vaccines at PSC level are stored in the ice line refrigerator. Is it true? Yes. The only thing is some vaccines require freezing temperatures. Normal temperature of a cold chain is +2 to +8 degrees Celsius. But some vaccines require a temperature of -15 to -25 degrees Celsius. Which is that vaccine? OPV, oral polio vaccine. So what should be done? OPV should be kept at the base of the ice line refrigerator, therefore. Okay? That's important. Next, option B. A vaccine carrier stores 6 to 8 vials of vaccines and 2 fully frozen ice packs. No. How many vaccine vials it can store? One vaccine carrier, it can store 16 to 20 vaccine vials. It can store, previous year question hai. It can store 16 to 20 vaccine vials. And how many ice packs? 4 ice packs can be stored usually in a vaccine carrier. Okay? So that's the wrong statement. Vaccines can be stored at state level for a duration of 3 months. Yes, at the level of state or regional level, in a walk-in cold room or in a walk-in freezer, storage duration can be 3 months. But at the level of district or at the level of PHC, the vaccine storage duration is only 1 month. Maximum chances of cold chain failure, previous year question, are seen at sub-center level or below, that is village level पे भी. ठीक है? Because lowest level of vaccine storage, answer is PHC. Because below PHC as sub-center and village, we do not store vaccines. Vaccines are only carried on the day of immunization or vaccination with the help of these vaccine carriers and the ice packs usually. No issues with this. Cold chain का temperature +2 to +8 ही होता है most of the times. Important is usually ice line refrigerator can work without electricity for a maximum of 5 days. Okay, every day it requires minimum how many hours of electricity to work? 8 hours of electricity. Who measures the temperature? Health. Who measures bola maine? Who measures the temperature? Who monitors the temperature? Health assistant. The healthcare worker at PSC. कितनी बार दिन में? Twice a day. And it is done with the help of this thermometer known as dial thermometer. Previous year question image based. No issues with this anybody? That's important to be remembered. Next, vaccine carrier can can maintain its temperature up to 24 to 48 hours, but a ice pack can only maintain its temperature up to 2 to 4 hours. No issues with this. Answer for this question should be option number B. Question number 94. A female patient with fatigue and pallor suggestive of anemia. Okay, along with homocystinuria, that is homocysteine has been eliminated or excreted out in urine. That means उस patient की body में homocysteine की levels क्या है, ज़्यादा या कम? Definitely there are more levels of homocysteine. Excess level of homocysteine is suggestive of which vitamin deficiency? Anybody? Vitamin B9, that is folic acid, and vitamin B12, that is cobalamin. दोनों में होता है. ठीक है? Normal methyl malonate levels. This is the differentiating feature. Important is, agar methyl malonic acid levels are elevated, that is suggestive of deficiency of vitamin B12. But if methyl malonic acid levels are normal, that is suggestive of vitamin B9 or folic acid deficiency. So methyl malonic acid is the one which will differentiate between both of them, because homocysteine levels are elevated in both the conditions. Okay? And if so, here which vitamin therapy can help in this patient? Folate, option B. Important is, agar they would not have mentioned anything about methyl malonic acid, then what should have been your answer? Very good. Then your answer should have been folate and cobalamin, because we are not sure then whether it is due to vitamin B9 or vitamin B12 deficiency. Important is, if you only give vitamin B9, तो क्या होगा? The patient's hematological condition will improve. Anemia ठीक होगा, but the patient's neurological symptoms will worsen. Okay, that has been a previous year question. अगर बस folic acid दोगे तो patient में होगा क्या? The neurological condition will worsen in the patient. That's the important thing. And we have discussed already, teardrop cells along with hypersegmented neutrophils and macrovalocytes are usually seen in a case of megaloblastic anemia. MCV, mean cell volume more than 100 femtoliters. So it is a case of macrocytic normochromic anemia. Okay, question number 95. A 17-year-old girl was kidnapped and police caught the accused and brought to the police station. After some time, the accused was found dead in the station. Inquest in this case should be done by. It is a case of POXO is usually applied when a underage female is getting raped. Okay, that is what is a POXO Act. POXO is different. This is a case of custodial death. A goes for what? Asylum deaths. B goes for postal deaths. Postal मतलब juvenile homes जो होता है, ठीक है, सुधार गृह जिसको बोलते हो तुम, rehabilitation centers, ठीक है. C goes for custodial death or custodial rape as well. Then D goes for dowry deaths and E goes for exhumation. These are the 5 conditions A, B, C, D, E, that in these conditions the inquest or the panchanama is carried out by a magistrate. Please remember, okay? Here the inquest or the panchanama is carried out by a magistrate. Magistrate inquest is covered under with CRPC. Jaldi say. CRPC 176. Whereas the most common type of inquest that we do in India, police inquest, police inquiry, and police inquest is covered under CRPC. It is covered under CRPC 174. छोटा number police का, बड़ा number magistrate का, because magistrate inquest is superior. Okay, that's the important thing. So only 5 conditions: A for asylum deaths, B for postal deaths, D for dowry deaths, E for exhumation, and C बच गया वो custodial deaths or custodial rape. Important is, in exhumation is what? Digging out dead bodies. What is the time limit? Was the previous year question. No time limit. Can dig out at any time usually. Important is, in cases of custodial rape, in cases of custodial death or custodial rape, who will be the one to carry out the inquest? Executive magistrate or judicial magistrate? So in cases of custodial rape, so as it has happened in the police custody, therefore it should be the judicial magistrate who carries out it. Matlab it should be a judge who will carry out it. Okay? Yaad rakhna, important is, who is a Executive magistrate. Executive magistrate is usually a person who is a government appointed official, something like subdivisional magistrate, tehsildar, additional collector, collector. These are the executive magistrate. Okay? They will carry out. They will carry out inquest in which deaths anybody. Dowry deaths and exhumation mainly. They will carry out inquest mainly in dowry deaths and exhumation. यहाँ पे executive magistrate will be preferred. But in cases of custodial death, custodial rapes usually, in this definitely the judicial magistrate will be preferred. Okay, no issues with this. Taking for giving false evidence even after taking oath is known as perjury. Very good. Perjury is defined under IPC section 191. Perjury is punished under IPC section 193. Vitriol large is nothing but acid attack. Acid attack is punished under IPC section 326A. But attempt to acid attack is punished under IPC section 326B. B से याद रखना है बच गई. ऐसा करके याद रखोगे तो इजी रहेगा. ठीक है, इंपॉर्टेंट. देन important dowry death is covered under IPC section 304B. B for BV or B for Bahu. Okay. IPC section 304A covers criminal negligence or medical negligence usually. IPC section 302 murder usually. Okay. Murder is defined by IPC section 300. Please remember that. No issues with this anybody. IPC section 312 to 316 cover criminal abortion usually. Please remember that. Okay? No issues with this. Most important. IPC section 84. McNaughton's rule. Okay, it will tell you about the criminal responsibility of an insane or an unsound minded person. Sarkari question here example. Okay? No issues with this. Question number 96 now. A man came for health checkup after his father had a cerebrovascular accident who died last month. He was having the history of hypertension. Okay, which type of prevention it is? So as there is history of hypertension, risk factor is present. Okay, but he is coming for health checkup. Health checkup ka matlab screening test, and all screening tests will come in secondary level of prevention because screening tests are done for early diagnosis of the disease, and early diagnosis is secondary level of prevention. Okay. Question number 97. Regarding the school health services recommendation, which of the following statement is true? Option A says minimum area should be 5 square feet per student. It should be 10 square feet per student. Option B says minus type desk are preferred. True statement. Option C says can allot 60 students per classroom. 40 students per classroom are recommended according to the recommendation. Board committee was the first who worked on comprehensive school health. The board committee was the first one to work on the school health, but the first committee to work on comprehensive school health was Renuka Roy committee. Anushka nahi re. Renuka Roy committee. No issues with this. That's important. ठीक है? Question number 98. और ये meal कितना दिया जाता है? Midday meal. How much of calories? 1/3 calories. How much of proteins? Half of proteins of the recommended daily allowance or the dietary allowance. That is a Sarkari question again. Midday meal scheme. Okay? Question number 98. A 40-year-old male presents with protrusion of chin, excessive sweating, impaired glucose tolerance. That means blood sugar levels are high, but they are not as high as diabetes. They are high as pre-diabetes, right? Impaired glucose tolerance का मतलब pre-diabetes होता है. And enlargement of hands and feet is there. Okay? Which of the following drug is a growth hormone receptor antagonist used to treat this condition? What is the diagnosis, anybody? It is a case of acromegaly. Growth hormone excess after puberty leads to acromegaly. Growth hormone excess before puberty will cause gigantism. Tall height will be seen with gigantism. But usually in acromegaly, tall height is not seen. Heel pad thickness will be more than 23 mm. Prognathism or protruding jaw will be there. Okay, there will be thick hands usually. Okay. Apart from this, important is the patient will have impaired glucose tolerance because growth hormone is known to increase blood glucose levels. So अगर growth hormone ज़्यादा तो blood glucose levels भी ज़्यादा हो जाएंगे patient. Important is drug of choice for acromegaly is definitely octreotide, but it is a somatostatin analog. That means it is a growth hormone antagonist. It is a growth hormone antagonist. Is it a growth hormone receptor antagonist? No. It is pegvisomant. Peg is nothing but long acting. Okay. So it is pegvisomant. नाम में ये ना soma, that is usually somatotropin or your growth hormone. Ant मतलब antagonist. So pegvisomant is nothing but growth hormone receptor antagonist. Growth hormone antagonist पूछा होता, then your answer would have been correct. It would have been octreotide or lanreotide. Octreotide or lanreotide is also the drug of choice for. Very good. It is also the drug of choice for secretory diarrhea. Along with that, very good. Bleeding or non-bleeding? Bleeding, esophageal varices. Please remember. Okay, so for these conditions, definitely octreotide is the drug of choice. Along with that, it is also the drug of choice for acromegaly as well. No issues with this. Cabergoline is a long-acting dopamine agonist. Very good. It is a long-acting D2 agonist. Now, if it is a D2 agonist, it will increase dopamine levels. And which hormone is antagonist to dopamine? अगर dopamine बढ़ता है तो कौन घटता है? Very good. Prolactin. So if dopamine increases, prolactin will decrease. Therefore, D2 agonists like cabergoline can be used to treat which condition? Hyperprolactinemia. Okay. So hyperprolactinemia के लिए the drug of choice should be D2 agonists like cabergoline. Not an option. Go for bromocriptine. But it is short acting. ठीक है. Olcegipant किस में use होता है? Migraine. Very good. Okay. Olcegipant is used in migraine. Question number 99. A patient on ATT, anti-tubercular therapy, presented to the clinic with tingling and numbness in her finger and toes, along with generalized weakness and pallor. This condition is due to deficiency of generalized weakness and pallor. Both are suggestive of anemia in the patient. Along with that, tingling and numbness sensation are suggestive of peripheral. So, which are the vitamin deficiency which can cause? So either it can be B6 or B12. B12 any which ways it is not an option. And as the patient is giving history of ATT, which drug is taken in the patient? Isoniazid. And this isoniazid is known to cause deficiency of which vitamin? Deficiency of vitamin B6, that is pyridoxine. That will lead to microcytic hypochromic anemia. Along with that, peripheral neuropathy in the patient. No issues with this. Important is that isoniazid is also a acetylator. That means it is metabolized by acetylation. And these SHIP group of drugs are also known to cause SLE. S stands for sulfonamides. S stands for hydralazine. I stands for isoniazid. And P stands for procainamide. Important. Which is the most common drug responsible to cause SLE among these SHIP drugs? Procainamide. Very good. It is procainamide. No issues with this, anybody? That's the important thing you need to be aware of. Next, rifampicin का side effect बताओ फट से. It causes orange discoloration of urine as well as tears. Okay, ethambutol. It causes optic neuritis, pyrazinamide, hepatotoxicity, liver damage, streptomycin, ototoxicity and nephrotoxicity. Please remember, these are the important things you need to remember. Question number 100. A patient underwent cystoscopy, that is examination of urinary bladder, which showed multiple yellow-white plaques in the bladder. HPE, histopathological examination, shows infiltrated in the lamina propria layer as shown below. What is the appropriate diagnosis? क्या दिख रहा है? What are these, anybody? These macrophages, they have taken inside the bacteria, but they are not able to digest them properly. Partially digested bacteria in the macrophages. कौन सी bodies बोलते हैं उनको? Previous year question ना भाई, सुना तो होगा. Michaelis-Guttman bodies. Michaelis-Guttman bodies are seen in which condition? Malakoplakia. Okay, malakoplakia is usually a type of cystitis, that is infection of your urinary bladder, which causes yellow colored patches in your urinary bladder mucosa. And when we take a biopsy, it will show the classical Michaelis-Guttman bodies, partially digested bacteria in the macrophages. Treatment antibiotics, that's it. Okay? Hemorrhagic cystitis is a side effect associated with which drug? Which anti-cancer drug? Very good. Cyclophosphamide for prevention of hemorrhagic cystitis. Mesna should be given in the patient. No issues with this, anybody? Question number 101. A 40-year-old patient with arthralgia, that is joint pain, oral ulcers, and generalized fatigue. She complains of oliguria and hematuria. Urine shows RBC casts as well. That is hematuria is there, no? Renal biopsy was performed and has been given below. What is the diagnosis? Diagnosis क्या है तुम्हारा? 40-year patient causing arthralgia, that is joint pain, along with oral ulcer, along with generalized fatigue due to anemia, along with oliguria due to kidney involvement, hematuria due to kidney involvement. Okay, so क्या है? Malar rash, discoid rash, serositis, oral aphthous, ulcers, arthritis. It is a case of systemic lupus erythematosus, SLE. And in SLE, when there is kidney involvement, that is known as lupus nephritis. So, in a case of lupus nephritis, definitely on kidney biopsy, which kind of lesions are seen? Very good. दिख रहे हैं ना ये क्या है ये सब लोग? So these are nothing else but the wire loop lesions. So wire loop lesions on kidney biopsy are suggestive of lupus nephritis, which is nothing but renal involvement in systemic lupus erythematosus. Okay, important is that. No issues with this, anybody? Important. Immunofluorescence will show full house effect. Okay, so याद रख लेना ये बात. So lupus nephritis should be the diagnosis. Drug of choice for SLE, steroids. Okay, that's important to be remembered. Okay, focal segmental glomerulosclerosis. Over there will be sclerosis of some part of the glomerulus, and it is commonly associated with HIV. Membranous nephropathy, usually in membranous nephropathy, it is commonly seen in elderly patient, and there will not be any history of systemic lupus erythematosus. And most important, there can be a history of cancer in the patient. Malignancy is associated with membranous nephropathy. And important, in membranous nephropathy, कैसा appearance दिखता है? Spike and dome appearance is seen on the immunofluorescence. ठीक है? Acute tubular necrosis is also not seen because acute tubular necrosis is usually seen in cases of rhabdomyolysis or myoglobinuria. ठीक है? What is this, anybody? These nodules. Kimmelstein-Wilson nodules. And Kimmelstein-Wilson nodules are the most characteristic feature of diabetic nephropathy. Okay, so please remember this. And what are these? किस type के deposits दिख रहे हैं? All glomerulonephritis cause granular deposits except these. Linear IgG deposits, ribbon-like deposits seen in good pasture syndrome. Which type of rapidly progressive glomerulonephritis? Type 1 RPGN it is. Okay? Question number 102. A 40-year-old male is having alopecia, that is hair fall, came to the hospital. His wife complains of some behavior abnormalities in him. He also has loss of eyebrows or loss of eyelashes on the lateral part. Doctor notices some abnormal findings on the patient's nails. Which of the following can be the type of poisoning in this patient? Patient is having alopecia. Along with that, there are behavior abnormalities. Along with that, there is loss of eyebrows. So alopecia is there completely from the body, not only scalp, but also the eyebrows and the eyelashes. So it is more likely a case of thallium poisoning. It is a case of thallium poisoning. Important is, please remember, in cases of thallium poisoning also, you can see hyperpigmentation on palm. Yes, you can see a hyperpigmentation on palm. You can see these nail findings as well at times. Okay? So please remember, hair loss, red color skin, peripheral neuropathies, gastrointestinal upset like diarrhea, and some mental changes or brain damage are features of thallium poisoning. No issues with this, anybody? That's characteristic. Diarrhea भी बहुत important है. It can help you make a diagnosis as well. ठीक है? Arsenic may definitely, which lines are seen on the nails? Aldrich, Mies lines. Okay, please remember what is seen on the palms? Rain, drop, pigmentation. Which kind of diarrhea is seen? Rice, watery diarrhea. So it will mimic which infection? Cholera. Which kind of mucosa is seen? Red, velvety, stomach, mucosa. Right? So that is what is important about arsenic. Okay. Thallium is the ideal homicidal poison to kill anybody. Okay, please remember. Ideal suicidal poison will be cyanide. But the most commonly used suicidal poison is usually OPCs. Okay, organophosphates. No issues with this, anybody? Question number 103. During a certain trial, the lawyer of the defendant asked a leading question and the opposite lawyer quickly raised an objection. The judge sustained the appeal and requested that the defense lawyer to avoid asking such questions. Leading questions cannot be allowed in any of the following except मतलब किसमें allow किए जा सकते हैं, where they can be allowed. You need to find that. There are three types of examination. We start with examination in chief, which is conducted by same side or opposite sided lawyer. Same sided lawyer. Then there is cross examination, which is conducted by opposite sided lawyer. And then there is re examination conducted by same sided lawyer, in which leading questions can be permitted only by the opposite sided lawyer, and cross examination the leading questions can be permitted. तुम बोलोगे dying declaration. Please remember dying declaration and deposition. Important याद रख लो बस. Dying declaration and deposition is the recording of a statement of a person or a victim who is dying. ठीक है? At that time, dying declaration can be recorded by anyone, police, doctor, magistrate. But deposition is always and always recorded by a magistrate. Oath is not required in declaration, but it is always required in deposition. Defense lawyer or the accused should not be present in declaration, but this should always be present in deposition. Cross examination is not allowed in declaration क्योंकि opposite sided lawyer ही नहीं है ना भाई. So it is only done in cases of deposition. Okay, definitely पूरा courtroom procedure हो रहा है. Legal value would be much more to dying deposition. Please remember. ठीक है. Next important, that if the patient survives, if the declarant survives, then dying declaration will not have any value. It will only have a corroborative value. कोई मतलब नहीं बनता अगर patient जिंदा रहता है. किसका? Dying declaration का. But in a dying deposition, even if the patient stays alive, then dying deposition will be considered because it is recorded by the magistrate himself. That's the reason. ठीक है? तो याद रखना. Role of doctor, previous year question. क्या होता है role of doctor in dying declaration as well as dying deposition? Our role is to assess compos mentis. That is whether the patient is in sound mind or not. That we have to tell. Okay? कि उसका दिमाग ठीक से काम कर रहा है या नहीं कर रहा. बस. ठीक है? Which is followed in India only dying declaration. We do not follow dying deposition. But superior one is dying deposition. It is only followed in developed countries. So important leading questions can be asked in dying declaration or dying deposition. It will be asked in dying deposition. क्यों? क्योंकि opposite sided lawyer is only present in dying deposition. Cross examination is only conducted in dying deposition. So therefore it cannot be conducted in dying declaration also. ठीक है? So it is only and only allowed in cross examination or dying deposition. ठीक है? Leading question, one important previous year question again. Leading questions are always and always asked by the opposite sided lawyer except one condition where it can be asked by same sided lawyer. Leading questions can be permitted by the same side lawyer only in one condition. क्या क्या होता है विटनेस के साथ? बराबर. क्या बोलते हैं ऐसे विटनेस को? Hostile witness. Please remember, only in cases of hostile witness, that means the witness is changing his statement, then the same sided lawyer will also be allowed to ask leading questions. Please remember. So in cases of hostile witness, leading questions can be permitted by the same sided lawyer. Chalo. Question number 104. An 11-year-old boy presented to the emergency with vomiting. Parents gave history of consuming 10 to 15 tablets of ferrous sulfate a day before. What is the antidote of choice in treatment of this patient? If iron के tablets इतने ज़्यादा खाए, that means the patient is having iron toxicity. So usually in this patient, the antidote of choice should be an injectable drug known as desferoxamine. अगर if they would have said it is a case of chronic iron overdose, कब होता है chronic iron overdose? That means in a case of thalassemia. Why? Because in a thalassemia you are giving repeated blood transfusion, तो बहुत ज़्यादा iron load हो जाता है body में. In that you give an oral drug, and that oral drug is known as deferiprone. Okay, that drug is known as deferiprone. Okay, no issues with this anybody? That's important. ये classical सरकारी question है, 2 बार repeat हुआ exam में. Question number 105. At an urban PHC, ANM is given 1 vial of pentavalent vaccine and 2 vials of oral polio vaccine. Both are already open before, provided that all the cold chain requirements are still intact. Will you use them or discard? Mark accordingly. Now, important is once we open the vaccine vial, okay, once we have opened the vaccine vial, we can use it for multiple number of times. That is covered under the open vial policy. Okay, it is only applicable for few vaccines. What are those vaccines? Anybody? DPT, that is diphtheria, pertussis, tetanus. Tetanus toxoid, that is TT. TD, that is tetanus and diphtheria. Along with that, hepatitis B. Okay. Along with that, HIV, DPT, hepatitis B, and HIV together are pentavalent vaccine. Along with that, oral polio vaccine. Along with that, IPV, injectable or inactivated polio vaccine. These vaccines can be used for a span of, after opening, till a span of till 28 days usually. Okay, they can be used till a span of 28 days after you open it. Only condition being the cold chain restrictions are properly followed and the heat sensitive label is still intact. Okay, expiry date is not reached. Okay, it is not applicable for measles, rubella, MR or MMR vaccine. Okay, it is not applicable for BCG vaccine. It is not applicable for Japanese encephalitis vaccine. It is not applicable for yellow fever vaccine because all of these vaccines are lyophilized. Very good, powder form. Lyophilized or reconstituted vaccine. उनको क्या करना पड़ता है? You need to make a solution out of it with the diluent. And once you have made the solution, you know reconstituted vaccines have to be used within a span of 4 hours. If they are used after 4 hours, they will cause toxic shock syndrome. That means reconstituted vaccine cannot be used for multiple vials. That's it. Okay? So all reconstituted vaccines are not covered under this policy. Now previous year question जो तुम्हारा एग्जाम का था उसमें उन्होंने एमआर वैक्सीन दी थी इंस्टेड ऑफ ओपीवी. तो इसीलिए बोलते हैं कि रट्टा ऑप्शन का मत मारा करो. ठीक है, तो टॉपिक समझा करो. Now pentavalent and OPV both are covered under the open vial policy. Therefore use both pentavalent as well as OPV open vials. ठीक है, अब समझे क्यों एक्सप्लेनेशन पढ़ना है ना कि रट्टा मारना आंसर का. दैट्स द बेसिक थिंग. हाँ, पीसीवी भी है. हाँ, पीसीवी भी आता है. इंपॉर्टेंट इज दिस वन, प्लीज रिमेंबर. दिस इज व्हाट? VVM, that is vaccine vial monitor. Vaccine vial monitor is a marker of, it is a marker of cold chain maintenance or it is a marker of heat sensitivity of a vaccine. Please remember, if the vaccine cold chain is not maintained, what will happen? The inner square will start changing its color because it is a heat sensitive label. Okay, if the inner square ka color is lighter as compared to the outer circle, then the vaccine can be used. But if the inner square ka color is equal to that of the outer circle, or if it is darker than the outer circle, then these vaccine vials cannot be used. That means the cold chain of these vaccine vials were not maintained properly. ठीक है? क्या हुआ? Question number 106. For an institutional delivery, Asha worker motivated a woman in an urban area of Madhya Pradesh. Okay, Asha worker and the second gravid mother are given what amount of money under Janani Shishu Suraksha Karyakram? So important is, याद रखना, if I talk about low performing states, तो low performing states में first of all about rural areas. Okay, पहले ही low performing है, ऊपर से rural areas है, मतलब they need more motivation to come to hospital for delivery. Therefore यहाँ सबसे ज्यादा पैसा मिलेगा. Mother is given how much? 1400 rupees and Asha worker is given 600 rupees. High performing state in rural areas, mother is given how much? 700 rupees and Asha worker is given how much? 600 rupees. No issues with this because it is rural area. Rural area में आशा का same है 600. If I talk about urban areas now, definitely in urban areas in low performing states, definitely the mother will be given 1000 rupees and the asha worker will be given 400 rupees. In high performing states, the mother will be given 600 rupees in urban areas and asha worker will be given 400 rupees. Easy to remember. Asha worker rural areas kitna? 600 rupees. Asha worker urban areas kitna? 400 rupees. No issues with this. That's how you can remember. उधर का आधा कर दो 14 divided by 2 700. ठीक है, और यहाँ का याद रख लो बस 1000 by 1000 and 600. नाउ ऑप्शन ही नहीं है तुम्हारे पास और कुछ. डेफिनेटली दे आर टॉकिंग अबाउट अर्बन एरियाज. अर्बन एरियाज की बात करें, आइदर मदर रिसीव्स 1000 और शी रिसीव्स 600. ये याद नहीं रहता तो आशा वर्कर रिसीव्स 400. ठीक है, आशा वर्कर रिसीव्स 400. So options A and C can be easily ruled out. Now we are left with option B and D. What is your answer? Option B, that is 1000 rupees to the mother and 400 rupees to Asha worker, because Madhya Pradesh is a low performing state in terms of maternal mortality. Question number 107. A patient came to the OPD with complaints of paralysis, okay, along with numbness after sleeping on his arm. Okay, which of the following explains the phenomena correctly? Now, after sleeping on your arm, definitely you are experiencing numbness and paralysis. That means it is due to what? Compression of the nerve fiber. Na? That means you need to talk about pressure sensitivity. Now there are three important types of sensitivity. One is hypoxia, second is pressure, third is local anesthetic. ये sequences याद रखनी जरूरी है because they have been asked in the exam. ठीक है, so hypoxia के लिए back याद रख लो, easy हो जाता है सब. ठीक है, hypoxia में the most susceptible nerve fibers are B followed by A and least susceptible are C fibers. Then pressure के लिए it is the same sequence, that is A, B and C. So most susceptible are A fibers and least susceptible are C fibers. Local anesthetic के लिए important, it is CBA. So most susceptible fibers for local anesthetic are C fibers followed by B fibers and followed by A fibers. ठीक है, तो ये फिजियो प्लस एनेस्थीसिया दोनों का क्वेश्चन है, सो इट कैन कम. एटलीस्ट रिमेंबर दिस टेबल, सामने चिपका दो अगर नहीं याद रह रहा. ठीक है, सो जल्दी से बताओ. ऑप्शन ए सेज A fibers are more susceptible to pressure than C fibers. Is it true? Yes, definitely. Okay, so any which ways you have got the answer. C fibers are more susceptible to pressure than A fibers. Wrong. They're least susceptible. C fibers are more susceptible to hypoxia than A fibers. No, they are again least susceptible. B fibers are more susceptible to pressure than A fibers. No, A fibers are more susceptible. Question number 108. A patient presented to the clinic with history of recurrent sinusitis. On examination of fungi is isolated, which has dichotomous branching. एक इससे कितने ब्रांच निकल रही है? दो. That is a dichotomous branching. At less than how many degree angle? 45 degree angle. Identify the organism. It is a case of Aspergillus. Which kind of hyphae? Septate or aseptate hyphae? Usually septate hyphae. दिख रहा है ना? Septations are usually seen. Okay. So septate hyphae will be seen in a case of Aspergillus, and we know that Aspergillus fumigatus is a cause of sinusitis as well in the patient. No issues with this. Important. अगर मैं बोलता हूँ aseptate obtuse angle at 120 degree hyphae, these are suggestive of mucor, that is zygomycetes species in short. Okay, these are suggestive of mucor or rhizopus, that is the zygomycetes species. No issues with this, anybody? That's it. Aspergillus, usually Aspergillus niger will form which color colonies? Black colonies usually. Okay, important. Okay, and H&E stain, as I've told you, it will show septate hyphae which are acute angle at 45 degrees and a dichotomous branching will be seen. Okay, and Aspergillus niger will cause automycosis. Which kind of appearance in ear? Wet newspaper appearance. Then it will also cause allergic bronchopulmonary aspergillosis. Which sign on CT chest? Halo sign, and also crescent sign can be seen. Okay, and this is the zygomycetes species, aseptate hyphae, obtuse angle branching usually. No issues with this. So please remember, we have three species in it: the mucor, which has no rhizoids; we have rhizopus, which have rhizoids exactly opposite to the sporangiophore; and then we have the absidia, which have internodal arrangement of the sporangiophores. दो rhizoids के बीच में. ठीक है? It can cause mucormycosis in the patient. Question number 109. A 24-year-old male who recently returned from Africa reported with jaundice and hemorrhagic fever. Fever plus yellowish discoloration of skin. Which fever? Africa is the endemic zone for yellow fever. Histology confirms the presence of Tories bodies, which are a characteristic feature of yellow fever. Symptomatic treatment was given, but the patient died. Which strain of the vaccine must have prevented? The yellow fever vaccine strain is 17. D. Edmonton Zagreb is for measles. RA27/3 for rubella. Rabies के लिए fixed viral strain. Nakayama Beijing P3 for killed or live? Killed. but the one which is used in Indian healthcare program is Japanese encephalitis live strain SA 14-14-2. Mumps, Geril, Lin, chickenpox, Oka strain. Please remember this. Okay? No issues with this, anybody? So at least remember these important wala. Dengue vaxia, CYD, TDV, Mosquirix, RTS. Okay? Anti-HIV, MVA, Ankara. ठीक है तो एटलीस्ट रिमेंबर द इंपॉर्टेंट वंस येलो फीवर के लिए विच स्ट्रैटेजी इज फॉलोड अब अगर इसमें कोई गलती करी किसी ने अगर कोई इसको इसके बाद ट्रेकोमा मार्क करके आ गया बेटा मेरे से आके मिलना उसके बाद सेफ स्ट्रैटेजी होती है ट्रेकोमा के लिए आई स्ट्रैटेजीज फॉर येलो फीवर अच्छे से नाम देख लेना एलिमिनेशन ऑफ येलो फीवर एपिडेमिक दैट इज व्हाट इज द फुल फॉर्म एलिमिनेशन ऑफ येलो फीवर एपिडेमिक इज द फुल फॉर्म आई स्ट्रैटेजीज फॉलोड फॉर येलो फीवर यूजुअली प्लीज रिमेंबर ठीक है एंड इंपॉर्टेंट इज सॉरी सॉरी येलो फीवर के लिए व्हाट इज द वेक्टर एडीज इजिप्टाई मॉस्किटो वेरी गुड इंपॉर्टेंट ठीक है अपार्ट फ्रॉम दिस येलो फीवर के vaccine is contraindicated during which time lactation or breastfeeding pregnancy may also it is contraindicated but it can be given if the patient wants to travel to a yellow fever endemic zone vaccination jab karte ho then the vaccination certificate is effective after 10 days it is effective after 10 days but it validation is for lifelong now okay validation is lifelong repeated question of your exam. Next is question number 110. A police officer admitted to the hospital with fever and myalgia. Myalgia is muscle pain. Physical examination revealed rash which is exclusively absent on palms and soles. The person is suspected to be infected with body lice. Lice. Which of the following infestation best explains this feature? टेबल जो दे रहा हूं एग्जैक्ट याद रखोगे तो इजी हो जाएगा फर्स्ट सीक्वेंस में एपिडेमिक टाइफस सेकंड इज ट्रेंच फीवर थर्ड इज स्क्रब टाइफस फोर्थ इज rickettsial pox fifth is Indian tick typhus sixth is Rocky Mountain spotted fever seventh is endemic typhus eighth is Q fever. Now important is reservoir for first two it is man for last one it is cattle बाकी सबके लिए it is rodent. Make the table on your own once or twice it will be easy. Vector easy first two louse next two might next two tick next one rat flea and last one no vector. That's how you can make it easier. Important is epidemic typhus epidemic में क्या आता है P so the causative agent is rickettsia provazeki. Please remember trench fever what is the cause trench fever is also known as Quinton fever so the causative agent is Bartonella quintana. Bartonella henselae is the causative agent of cat scratch disease. दोनों recent question है. Quinton fever is not Q fever. Quinton fever is trench fever. ये बात याद रखनी है. तो इसलिए the causative agent is Bartonella quintana. Q fever को Q fever या query fever बोला जाता है. Quinton नहीं बोला जाता. That's the basic idea. Next important is scrub typhus. What is the causative agent? Orencia Susu Gamushi. Rickettsial pox. What is the causative agent? Rickettsia akari. Then Indian tick typhus. India के लोग सबको कोने में ले जाते हैं. So the causative agent is Rickettsia conori. Rocky Mountains जो ले जाते हैं वो हंसते. Then Rocky Mountains fever. Causative agent is Rickettsia rickettsii. Mnemonic is triple R. ठीक है R. Rocky Mountain fever rickettsii. ठीक है endemic typhus. Causative agent is Rickettsia typhi and Q fever causative agent is Coxiella burnetii. No issues with this. Drug of choice for all rickettsial diseases doxycycline. Shabash. Test which is done. Question have been asked on both of them. Wheel Felix test. Please remember that. ठीक है. So यहाँ पे body lice है मतलब either it can be trench fever or it can be epidemic typhus. Now definitely have they given anywhere Bartonella quintana? No. So it is a case of epidemic typhus. So it is a case causative agent is Rickettsia provazeki. No issues with this anybody? Please remember this. ठीक है? तो लाइस याद रख लेना, टेबल इजी याद हो जाएगा. Question number 111. The following histological image is seen in the patient who is complaining of abdominal distension and growth failure. Signs of anemia, thrombocytopenia, and bone pain are present. Which enzyme is deficient in this patient? Diagnosis, please. बन गया आज diagnosis सबके हैं? Gaucher's disease. कल तक तो बोल रहे थे केस ही नहीं आता. So important is Gaucher's disease. Please remember. The patient will have abdominal distension. Why? Because the child will have hepatosplenomegaly. ज़्यादा बड़ा क्या होगा? Spleen. So it can be written as splenohepatomegaly as well. ठीक है? Massive splenomegaly का one of the cause was Gaucher's disease. तुम देख सकते हो कितना बड़ा पेट है. Next, this excess of glucocerebroside will deposit in the bone and therefore it will inhibit the growth of bone. And classical deformity seen. It is known as which flask deformity? It is known as the Erlen-Meyer flask deformity. Okay, Gaucher's disease mein which deformity is seen in bone? Erlen-Meyer flask deformity. And important is, as this glucocerebroside will deposit inside the bone marrow, will the hematopoietic stem cells get enough space to divide? No. That's the reason why patient has pancytopenia. Along with that, in the bone marrow biopsy, you can get these macrophages which are having which kind of appearance? Crumpled tissue paper appearance. That is a classical feature. So crumpled or wrinkled tissue paper appearance is seen in the cases of Gaucher's disease. Please important. Most common lipid storage disorder and the enzyme deficiency is glucosidase. Beta glucosidase, also known as beta glucocerebrosidase, also known as beta glucosyl ceramidase. Glucose 6 phosphatase causes von Gierke's disease. Beta galactosidase causes Krabbe's disease. And alpha galactosidase causes Fabry's disease. दोनों में कंफ्यूजन हो तो कैसे याद रख लो? डबल बी किस में आता है? उसमें बीटा गैलेक्टोसिडेज है. ठीक है, एक बी आएगा फैब्रीज में तो उसमें अल्फा गैलेक्टोसिडेज है. डबल बी जिसमें आता है उसमें बीटा गैलेक्टोसिडेज. ट्रू अबाउट टीलोमियर्स एंड टीलोमरेज. टीलोमियर कहाँ होता है? Where are telomeres, guys? They are present at the ends of the chromosomes to prevent joining of any or adhesion of any chromosomes usually. And the telomere length shortens with aging or lengthens with aging. So telomeres definitely with every cell division क्या हो जाएगा उनका? With every cell division there will be shortening of the telomeres definitely. Which is the enzyme that can prevent this telomere shortening? Telomerase. Telomerase enzyme will prevent this telomere shortening. वो उसको छोटा ही नहीं होने देगी. अगर छोटा ही नहीं होने देगी, will the cell die? No, the cell will become immortal. अमर हो जाएगा. And these are seen with cancerous or your malignant cells. Now, normally increased telomere length with aging? No. Decreasing length of telomeres with aging? Yes. So answer should be option B over here. ठीक है? Telomerase is found in somatic cells? No. Telomerase is found in germ cells because they are rapidly dividing. They are found in malignant cells because they have to constantly divide. Question number 113. A woman who is a known case of heart disease with history of using anticoagulants presents with bleeding now. She gives history of bulky, greasy, foul-smelling stools. Which of the following deficiency can lead to this? So as she has been using anticoagulants, anticoagulant usually the oral drug which is oral warfarin and it is antagonist of vitamin K usually. Definitely the patient will develop deficiency of vitamin K. And I hope all of you are quite aware A, D, E and K are fat soluble vitamins. So definitely the patient will have fat malabsorption also. The patient is having fat malabsorption. Due to that, all that fat is excreted out in those stools. Fat forming, bulky, greasy, foul smelling stools known as steatorrhea. So please remember steatorrhea can be associated with these fat soluble vitamin deficiencies as well. Okay? So which vitamin deficiency can lead to this? It is vitamin K. Vitamin K is usually the most deficient vitamin in breast milk, followed by vitamin D. That is the reason why vitamin K injection is given at birth. Previous year question, it is given to prevent hemorrhagic disease of newborn. Less than 1 kg, 0.5 mg. More than 1 kg, 1 mg intramuscular injection at birth itself. Vitamin D, how much supplementation is given till 1 year of age? 400 international unit. Most deficient vitamin in cow's milk, vitamin C, C for C. Cow's milk में C सबसे deficient होता है. No issues with this anybody? Question number 114. A patient is having loss of vision in bilateral temporal fields. On investigating, a vessel developed an aneurysm usually. Aneurysm is nothing but a dilatation of a vessel, which was seen on an angiogram. Involved vessel is circle of Willis. Jaldi se. This is the internal carotid artery. Internal carotid artery ki first branch is known as ophthalmic artery. Then the another branch is known as anterior cerebral artery. Both of them are connected in the center by anterior communicating artery. ठीक है? And the extension of internal carotid artery on both the sides is the middle cerebral artery. Next is definitely two arteries are coming from the spinal cord, and these are spinal column. These are known as vertebral arteries. Vertebral arteries combine to form the single basilar artery, and basilar artery again divides to form the posterior cerebral artery. ICA and posterior cerebral artery are connected with posterior communicating artery. This together forms the circle of Willis. Which artery does not take part in circle of Willis formation? Very good. Middle cerebral artery is not a part of the circle of Willis. It is the internal carotid artery which is a part of circle of Willis. That you need to remember. Okay? So that is important thing. Now important is यहाँ पे ये जो anterior communicating artery है. If there is any aneurysm over here, it is very close to the optic chiasma. So if there is any aneurysm in the anterior communicating artery, usually perianeurysms, they are known to compress the optic chiasma. Which fibers? Nasal fibers. So if nasal fibers are compressed, there will be loss of vision in both the temporal fields, and that is called as bitemporal hemianopia due to compression of optic chiasma. So which vessel aneurysm is more likely? Anterior communicating artery. शायद मैंने subarachnoid hemorrhage में surgery में लिखवाया है कि most common site for berry aneurysms is anterior communicating artery. ठीक है? So that's the important thing. जल्दी से ये बता दो. This vertebral artery से जो arise हो रही है, this is the posterior inferior cerebellar artery known as PYQ. This is the anterior inferior cerebellar artery known as ICA. This is the superior cerebellar artery. This is the central artery known as anterior spinal artery. जल्दी से, if vertebral artery followed by PYQ, okay, most common cause is vertebral artery followed by PYQ. If they get blocked, which syndrome? Very good. It causes lateral medullary syndrome, also known as Wallenberg syndrome. There will be multiple cranial nerve palsies, that is 5, 7, 9, 10, 11. Okay, sometimes 12th also. That is the lateral medullary or the Wallenberg syndrome. Anterior spinal artery, guys. It causes medial medullary syndrome. Which cranial nerve palsy? 12th cranial nerve palsy along with contralateral hemiplegia. Next important, basilar artery. Basilar artery blockage, your stroke causes Millard-Gubler syndrome. Which cranial nerve? 6th and 7th cranial nerve palsy along with contralateral hemiplegia. P1 part of posterior cerebral artery blockage. 3rd cranial nerve palsy along with contralateral hemiplegia known as which syndrome? Weber syndrome. ठीक है, at least नाम याद कर लेना, that's more important. Last structure which is encountered during lumbar puncture is, now, if we are performing lumbar puncture, we need to go into which space? Subarachnoid space, because we want to collect CSF. Important is, उसके लिए ये पता होना चाहिए that spinal cord ends at which level? Spinal cords ends at, adults में it ends at, adults में it ends at the level of L1, upper border या lower border? It ends at lower border of L1 in adults, whereas in neonates or infants, it ends at the level of L3, upper या lower border? Upper border of L3, whereas subarachnoid space ends at, subarachnoid space इसी के बीच में तो करना होगा ना, स्पाइनल कॉर्ड खत्म और subarachnoid space इन दोनों के बीच में. Subarachnoid space ends at the level of S2. So therefore, between L1 and S2, we have the space to perform a lumbar puncture. The best site to perform a lumbar puncture. सरकारी question है तुम्हारे exam के. L3 and L4, but a neonate we will prefer L4 and L5. ठीक है? No issues with this anybody? चलो जल्दी से जब lumbar puncture करना है, it can also be used for spinal anesthesia. Same layers will be pierced. Okay? सबसे पहले will be piercing the skin, followed by the superficial fascia, followed by the supraspinatus ligament, followed by the ligamentum interspinous ligament, followed by ligamentum flavum, followed by epidural space. Then we will pierce the dura mater. Then we'll pierce the arachnoid matter. Then finally we'll go into the subarachnoid space. So subarachnoid space में जाने से पहले last layer to be pierced is arachnoid matter. So answer should be option C, arachnoid matter. Important is अगर तुम्हें epidural anesthesia देना है, so which is the last layer to be pierced? Very good. So in cases of epidural anesthesia, if you want to give, definitely the last layer to be pierced is the ligamentum flavum, because after that you reach the epidural space. No issues with this. So last layer pierced in lumbar puncture or in cases of spinal anesthesia. Answer should be arachnoid matter. But last layer punctured in cases of epidural anesthesia. Answer should be ligamentum flavum. No issues till anybody? So please remember this. Question number 116. A research scholar, while studying cytoskeleton, came across several strands of fibrous proteins that were wound together in stable structure and distribute tensile forces across the cells and tissue. So this is keyword. Tensile strength दे रहा है वो tissue को. Which one of the following structure is best suited? So important is, please remember, there are three structures which form the cytoskeleton of a cell. What is the cytoskeleton? Basic framework of a cell. Outline बनाते हो ना किसी भी चीज की. Normally हम दीवारें बनाते हैं उसी पे घर बनाया जाता है ना. So just like that, cell also has a normal framework. That framework is called as cytoskeleton. Okay, that is formed by microfilaments, intermediate filaments, and microtubules. Important. Microfilaments are formed of which protein? Actin usually. And they are responsible for what? They are responsible for formation of the structure and movement of the cell. Intermediate filaments, you please remember, they are responsible for maintaining the structural integrity, that is shape, size of the cell. Along with that, they are also responsible to provide tensile strength to the cell. Microtubules usually, they are responsible for intracellular movement. ये tubular structure होता है. इनके बीच में से कुछ ना कुछ सब्सटेंस पास होता है एक कोने से दूसरे कोने में. टनल है ये मान लो. So microtubules are responsible for intracellular movement. Okay, so please remember that. So definitely, as they have mentioned about tensile forces or tensile strength, it will be provided by intermediate filaments usually. It will be provided by intermediate filaments. Question number 117. A middle-aged farmer grew mainly maize as staple food. He presents through OPD as shown in the image. Deficiency of which vitamin is shown below? So definitely maize eaters are at a risk of developing niacin or vitamin B3 deficiency leading to pellagra. And what is the classical dermatitis shown in the image? Casals necklace. Okay? Chalo. Question number 118. A truck driver came with complaints of painless ulcer in genital area along with painless inguinal lymphadenopathy. He gives history of unsafe sexual intercourse. Which among the following can be used for visualizing the motility of organism? It is the dark field microscopy which will stain only the background, and the spirochetes, it will glow. Okay, the spirochetes, that is Treponema pallidum, will glow because the causative agent is Treponema pallidum and the disease is syphilis. If both the conditions are painless, if there is a painless genital ulcer and there is a painless lymphadenopathy, okay, so painless genital ulcer and painless lymphadenopathy, that is a case of syphilis. Primary syphilis presents with this painless genital ulcer known as hard शंकर. कैसे याद रखोगे? शंकर के लिए, शंकर जहर पी गए तो शंकर के लिए सब कुछ पेनलेस होता है. ठीक है, तो पेनलेस lymphadenopathy and painless genital ulcer is seen in cases of syphilis. Causative agent being Treponema pallidum. Secondary syphilis में you can see these regions over the soles and the palms known as, क्या बोलते हैं इन regions को? condyloma lata. Okay, so please remember these are known as the condyloma lata, the secondary regions which are there. Okay, whereas tertiary syphilis, ma'am, please remember in tertiary syphilis which is there, the lesion which is formed, it is ulcerative lesion known as gumma. And finally, after tertiary syphilis, it will progress into neurosyphilis. Please remember that. What is the drug of choice for syphilis? What is the drug of choice for syphilis? It is benzathine penicillin G. How much is the dose? 2.4 million international units. Okay. Single injection or 3 injection? Single injection in primary syphilis, secondary syphilis, and early latent syphilis. Whereas 3 injections in late latent syphilis and tertiary syphilis. Important. What is the drug of choice for neurosyphilis? It is only penicillin G or aqueous form of penicillin G. Reason is if benzathine is present, benzathine makes it long acting, but benzathine could not cross blood brain barrier. Therefore ये previous year question था, सब मुंह उठा के benzathine मार करके नहीं हो सकता. Benzathine penicillin G cannot be the drug of choice for neurosyphilis because it cannot cross the blood brain barrier. Please remember that. Okay, no issues with this anybody? याद रखना बच्चों. Next is chancroid usually. Chancroid में the ulcer is painful and the lymphadenopathy is also painful. कैसे याद रखना है? The causative agent is Haemophilus ducrei. So do cry. Okay, do cry, row. So that means everything is painful usually. ठीक है? Which appearance is seen? School of fish appearance is seen on gram staining. Okay, drug of choice. Azithromycin. Next, donovanosus, also known as granuloma inguinale, also known as granuloma venerum. Causative agent is Klebsiella granulomatis और दूसरा नाम सरकारी Calimatobacterium. Okay. Here the patient only develops a genital ulcer. Painful or painless? Painless genital ulcer without any lymphadenopathy. Lymphadenopathy होती ही नहीं है. Okay, so that's the important thing. तो क्या होता है? Nodules, which can be seen as lymphadenopathy, and therefore it is called as fake buboes or pseudo buboes. Okay, next important is which kind of appearance is seen of bacteria? Safety pin appearance, and macrophages having bacteria is known as Donovan bodies. Drug of choice again azithromycin. Last one, if the patient is having painful lymphadenopathy and a painless genital ulcer. This is a case of lymphogranuloma venerum, okay, caused by chlamydia trachomatis with serovar, L serovar, okay, and that causes lymphadenopathy that is known as buboes. Which test? Price test. With sign? Groove sign. Drug of choice? Oxycycline. शाबाश. तो ये STDs याद रख लेना, important है बहुत. Question number 119. A patient was brought to the surgery emergency with perforation peritonitis. So he underwent exploratory laparotomy. Post few days of surgery, patient complains of abdominal pain and fever. X-ray of abdomen reveals the following. This can be best explained by. Explain पे क्या दिख रहा है? X-ray पे forceps are left in the abdominal cavity. This is a case of gross negligence or a case of criminal negligence, definitely. Here, do we need any proof? No, nothing is required. That means the fact speaks for itself or the evidence speaks for itself. That is nothing else but res ipsa loquitur. Res judicata is nothing but the things are already decided. Novus actus intervenus means you were performing a new act due to which there was some complication. Next is therapeutic misadventure. That means you are performing some surgery and during that surgery there was bleeding. So that is any which ways a therapeutic misadventure that can happen during a surgery. For that you will take a consent before surgery definitely. But this cannot be. Even after taking consent, this cannot be done. Okay, you are to be punished under IPC section 304A. Question number 120. A man keeps calling various females and talks obscenity, rubbish, okay, and shares obscene pictures with them, which gives him sexual gratification. What is the condition described known as? It is known as scatologia. Okay? So this is known as scatologia. No issues with this. If the patient is peeping into someone's private act, and achieving sexual gratification. That is called as peeping Tom, also known as voyeurism, also known as scoptophilia. Okay. If achieving sexual gratification by rubbing private parts is known as crotcherism, IPC section 290. Okay. Vitriolage I've already told you. Okay. Exhibitionism is nothing but flashing private parts in the public space. Onanism is nothing but ipsation or masturbation. It's called as onanism. Question number 121. A child while playing consumed a fruit from the garden. The child was fine for some time, but then he had high grade fever, appeared confused, photophobia, decreased salivation, that is dry mouth. What is the possible causative agent and the antidote? So we know it is more likely a Dhatura, which is a deliriant. Dhatura alba is more common than Dhatura nigra. And the horn apple which is there is known as Dhatura stramonium, also known as Jimson's weed. ये previous year question आया था, image दी थी and बस इतना ही पूछा था क्या है. Option में था Jimson's weed. ठीक है. Active principle is known as hyoscine or atropine. Both are anti-muscarinic or anticholinergic agent. So anticholinergic features will be seen. 8 Ds. D for dry mouth. Second D for dry skin. Third D for dysarthria. Fourth D for dysphagia. Fifth D for dilatation of pupil. 6D for delirium. 7D for drunken gait. And last D for death. How many seeds are fatal? 100 seeds are fatal. Okay, it is also known as railway or roadside poison. Okay, so that's important. So definitely it is a case of dhatura poisoning. As it is an anticholinergic poison, so treatment of choice should be cholinergic drug, and that should be physostigmine. Physostigmine is also the drug of choice for which toxicity? Atropine toxicity. Cannabis का दूसरा नाम rope, joint, weed, marijuana and grass. बताने की जरूरत वैसे तुम्हें है नहीं. ठीक है. Most commonly abuse substance illegally. Okay, so that is what is cannabis. Active principle, classical question. THC, tetrahydrocannabinol. Which kind of smell comes? Burnt rope smell. And that leads to a motivational syndrome. समझ रहे हो काहे नहीं आ रहा motivation? हुको और पता चलेगा. ठीक है? Actually, it causes amotivational syndrome. You have lack of desire in anything. खाना खाने का मन नहीं करेगा, बता रहा हूं मैं. ठीक है? So important is that. Next is run amok. Run amok is stabbing spree. That is irresistible desire to kill somebody. तो अगर साथ वाला भुगता है बच के रहो भाई. कभी भी रात में हल्ला हो सकता है. ठीक है? Then the patient will also get flashback phenomena usually. Cocaine usually, cocaine का fatal dose कितना होता है? 1 gram orally. It causes ulceration or perforation of septum, and it will lead to tactile hallucination known as cocaine bugs, also known as formification or with symptom Magnum symptom. It is a sympathomimetic drug and it is a potent vasoconstrictor. It is also used as a local anesthetic agent. Question number 122. A person is not able to hold the paper between the fourth and the fifth finger. He is also having sensory loss in the fifth finger and the medial half of the fourth finger as well. Structure responsible for the following symptoms is likely to be damaged at which of the following site? What is the nerve injury over here? Ulnar nerve injury. And ulnar nerve injury is due to fracture at which side? Answer is medial epicondyle. Please remember, fracture at surgical neck of the humerus will cause what? Damage to which nerve? Axillary nerve. And which artery? Posterior circumflex humeral artery. Fracture of shaft of the humerus causes which nerve injury? Radial nerve. And which artery? Profunda brachii artery, because both of them pass via the radial or the spiral groove. Next is fracture of the medial epicondyle causes injury to the ulnar nerve. And which artery? Ulnar collateral artery. Okay, fracture of supracondylar fracture of humerus. It causes damage to which nerve? Median nerve. And damage to which artery? Brachial artery. कोई दिक्कत नहीं है इसमें. And definitely fibular neck fracture or lateral tibial plateau का fracture. It causes common peroneal nerve injury leading to foot drop. ठीक है? Ulnar nerve injury important है. Causes which kind of deformity? Partial claw hand. It causes sensory loss from medial 1.5 fingers, ventrally as well as dorsally. दोनों तरफ से वही करता है. Then which sign is this able to adduct this little finger, known as Wartenberg's sign. So Wartenberg's sign will be positive. I'm not able to hold the paper usually with the help of adduction. I'm holding it with the help of flexion. This is known as Froment's test or the Froment's sign. That is also positive in ulnar nerve injury. It is also known as book test or the card test. I'm not able to move my fingers. That is known as Igawa test. Majority of intrinsic muscles of hand are innervated by ulnar nerve. It innervates small muscles of the hand. Therefore, it is known as musician's nerve as well. अल्नर नर्व इंजरी कौन सा स्प्लिंट देते हो? कॉकअप किसको दिख रहा है भाई? इट इज द नकल बेंडर स्प्लिंट. ठीक है, नकल सब बेंड. ओके, नकल बेंडर स्प्लिंट इज गिवन इन केस ऑफ अल्नर नर्व इंजरी. Question number 123. While examining a newborn baby in the nursery, a physician notes meconium is coming out from the umbilicus. Which of the following embryonic structures has abnormally persisted in this patient? We know that usually ये बहुत बार मैंने explain किया है. In the fetal life, there is an abnormal connection between the midgut and the umbilicus. Intestinal duct, also known as omphalomesenteric duct, that should obliterate or that should disappear after birth. But if it remains completely patent, then there will be a formation of Wittline fistula, and that Wittline fistula will lead to passage of meconium or stools from the umbilicus. So it is due to complete patency of which structure? Vitello-intestinal duct. There is partial intestinal duct, then that leads to a outpouching from the intestine known as Meckel's diverticulum. So partial patency of duct causes Meckel's diverticulum. Whereas there is also abnormal connection in fetal life between the urinary bladder and the umbilicus. That structure is known as allantois, and allantois ka remnant is known as urachus. It should also disappear after birth. But if it remains patent, then this is called as urachus fistula. And what will come out by umbilicus now? Urine will come out. Okay, so that is due to partial, that is due to complete patency of your allantois or urachus. A patient came with class 3 dog bite. Class 1 dog bite is only licking. Class 2 dog bite is bite marks are seen or scratch marks are seen. Class 3 dono. Class 3 dog bite is bleeding is seen. ठीक है? Previous profile, so the patient had class 3 dog bite and previous prophylaxis for monkey bite was given 6 months ago. What is the next step in management? Important. Class 1 bite में क्या करते हो? Only wash the wound with soap and water. Class 2 bite में क्या करते हो? Wash the wound with soap and water plus anti-rabies vaccine. Class 3 dog bite में क्या करते हो? Wash the wound with soap and water plus anti-rabies vaccine plus rabies immunoglobulins are to be added. Now, this patient had a class 3 dog bite. He had already received prophylaxis earlier. और 6 महीने पहले ही दिया है. That means he has already received prophylaxis. ठीक है? वापस से उसको bite हुआ है. So now it will be a case of re-exposure. It will be a case of re-exposure. So now in cases of re-exposure, please tell me what should be done. कितने doses? Usually, we need to see if the next dog bite, the second dog bite which is there, the re-exposure, it is within 3 months or after 3 months of the last bite usually. ठीक है? ये prophylaxis दिया था. Okay, full prophylaxis was taken. Now, if it is within 3 months, then what has to be done? Nothing has to be done. Just wash the wound, clean the wound. Okay, 3 months you will be. And if it is more than 3 months, then we need to take 2 doses. That is on day 0 and day 3. Okay, so after 3, as the patient is having re-exposure after how many months? 3 months. So it is definitely we need to take how many doses? 2 doses. So wound cleaning along with anti-rabies vaccine on day 0 and day 3. Jaldi se batao. Day 0, 7 and 28. Here we this is the prophylaxis for pre-exposure, post-exposure. This is the pre-exposure prophylaxis. No issues with this. Post-exposure prophylaxis is usually via 2 regime: intramuscular regime or the intradermal regime. Intramuscular regime is known as SN regime. Intradermal regime is known as high updated Red Cross regime. Important. Intramuscular regime. कितने doses? 5 doses. Day 0, 3, 7, 14, 20, 28, 21 या 28. Okay, important is that. Next, intradermal regime. How many doses? 4 doses. Kitna? 0.2 ml. 0.1 ml on one deltoid and 0.1 ml on another deltoid. तो एक बार कितने इंजेक्शन देते हो? 2 इंजेक्शन देते हो. कितने doses? 4 doses. Day 0, 3, 7, 28. 14th dose is not given in intradermal regime. An intradermal regime is followed nowadays in India. याद रखना है बात. Question number 125. A 10-year-old boy is brought to the emergency in altered sensorium and ongoing seizures. His family belongs to rural area and they give history that the child is unimmunized, and further history taking reveals that he had fever with erythematous rash few years ago. The child was more likely suffering from which among the following disease? What is the likely diagnosis now? Now, very good. It is a long-term and a rare complication of measles known as SSPE, that is subacute sclerosing panencephalitis. Due to inflammation of brain, patient is having altered sensorium and seizures as well. Okay. Now, SSP, we know it is a long-term and a rare complication of measles. Very rarely develops after 8 to 10 years usually. Okay? As the child was unimmunized and also there was a history of fever and erythematous rash, that was more likely a case of measles infection in the childhood. Most common complication of measles. Shabash, it is otitis media. Okay, please remember this. No issues with this. The answer should be measles for this. And what is the most pathognomic feature of measles in oral cavity? These are the white or bluish color spots opposite second lower molar, known as Koplik spots. Incubation period is 10 to 14 days. Single best answer, 10 days. Question number 126. A study started in the month of February 2022, where labor room records of patient admitted in month of January 2022 with labor pain was analyzed to know the effect of oxytocin for induction or augmentation of labor to the neonatal outcome. What type of study was used? So as we are starting the study, see, important is this. Now, if we start the study today, and if I take two groups, one with risk factor, another without risk factor, that means one exposed population, another non-exposed population. I follow them up, I calculate the incidence, then this will be a forward direction study known as prospective cohort study. But इसमें बहुत time और बहुत पैसा लग जाता है. That's the reason what I do, I need incidence. Therefore, I start the study today, but I go backwards and I take two groups with the records which are available. I take one group which is having the risk factor and the another group which is not having the risk factor. Okay, मैं टाइम में पीछे जाके किसी हॉस्पिटल के रिकॉर्ड से मैं दो ग्रुप्स उठाता हूँ, एक होता है एक्सपोज, दूसरा होता है नॉन एक्सपोज, और उन पेशेंट्स को मैं फोन करके आप पूछता हूँ कि कितनों में डिसीज हुआ और कितनों में डिसीज नहीं हुआ. हाउ मेनी ऑफ देम हैव डेवलप्ड द डिसीज एंड हाउ मेनी ऑफ देम हैव not developed the disease. So now I will get the incidence, the number of cases definitely, but it has also saved my time as well. This is a case of retrospective cohort study. I'm going back in time and I am again coming front in time. But if I take two groups, not exposed and non-exposed, but one will be the deceased or the patients, that is cases, and one will be the healthy individuals, that is controls. And then I am asking them the history of risk factor exposure. Then this will be called as the case control study. No issues with this? So as I've started this study in the month of February 2022, but I went back in time in January 2022, I took two groups. कौन से? One, usually the one who was given oxytocin and the other who was not given oxytocin usually. And I want to see the neonatal outcome after the use of oxytocin during labor. That is, I am taking one group who is exposed and the another group who is non-exposed. So exposed और non-exposed ले रहा हूँ तो कौन सी स्टडी हो गई? Cohort. But अगर मैं back in time जाके ले रहा हूँ तो कौन सी स्टडी हो गई? Retrospective cohort. So answer should be option C, that is retrospective cohort study. Question number 127. A study conducted on people who are having depression and on healthy individuals. People who are having depression, matlab the cases, and people who are healthy individuals, matlab controls. नाम में ही आ गया. And the time given to all social media was recorded. Which type of study is this? It is a case of case control study. Easy. तो ग्रुप्स देखना है, हमेशा ग्रुप्स देखना है. कौन से दो ग्रुप्स है? डिसीज और कंट्रोल से, केसेस और कंट्रोल से, या फिर एक्सपोज्ड एंड नॉन एक्सपोज्ड है. इफ यू अंडरस्टैंड दैट, it will become much easier. Question number 128. A 20-year-old pregnant female at 7 weeks of gestation presents to you for medical termination of pregnancy, MTP. Which among the following drug is used for MTP? Mifeprostone, which is anti-progestin, which will help in killing the fetus. How much? 200 mg given on day 1. And then once the fetus is killed, we will give a prostaglandin, even analog, that is misoprostol on day 3. It will cause smooth muscle contraction and expulsion of the fetus. How much? 400 to 800 micrograms. Depending on the size of fetus, you can even start from 400 micrograms. So the maximum dose which can be given is 800 micrograms for MTP. Maximum dose which can be given during PPH is 1000 micrograms. Each tablet of misoprostol is 200 micrograms. August ka question. How many maximum tablets of misoprostol can be given per vaginally in a patient of PPH? 5 tablets. PPH के लिए maximum doses 1000 micrograms. MTP के लिए maximum doses 800 micrograms. That's the difference. Okay. Till 7 weeks, the main method of termination of pregnancy is medical. Okay. From 8 to 10 weeks, usually it is suction and evacuation. And it is done by which cannula? It is done by this classical Carman's cannula. And Carman's cannula ki size should be equal to, it should be equal to the period of gestation. That means अगर वो बोलता है कि 8 weeks की pregnancy, I need to use 8 number cannula. This was a recent twice repeated question in exam. ठीक है? Next, what is this? Shabash. This is a Hegas dilator. Along with Hegas dilator, what is this? Uterine. This is uterine curette. Sound बस लंबा सा pipe होता है. And this will be used for dilatation and curettage, which is done between 10 to 12 weeks. And after 12 weeks, it is only prostaglandin analogs like misoprostol which are given. No issues with this. Medical termination of pregnancy can be done up till 24 weeks. 0 to 20 weeks, 1 doctor opinion. 20 to 24 weeks, 2 doctor opinion. That is important. Question number 129. Acute encephalitis syndrome cases were reported from Gorakhpur, Uttar Pradesh. The health authorities decided for mass vaccination under the Universal Immunization Program. Identify the vaccine type and route. What is the disease usually? So definitely Gorakhpur, Uttar Pradesh and encephalitis syndrome. It is more likely an endemic state for Japanese encephalitis. Japanese encephalitis is the most common cause of encephalitis in India also. ठीक है? Japanese encephalitis के लिए which vaccine is given, live or killed in India? Live vaccine. Okay. It is intramuscular or subcutaneous. Only 2 vaccines which we give subcutaneously in Indian healthcare program. One is Japanese encephalitis live and second is MR vaccine, that is measles, rubella vaccine. Only 2 vaccines we give intradermally. One is BCG vaccine. Second is IPV, inactivated polio vaccine. Rest all vaccines are given via the intramuscular route. No issues with this on the thigh of the child. Okay, so याद रखना ये कम से कम easy है. Question number 130. A patient from amplifier host. सरकारी question 3 बार repeat हुआ है. Amplifier host of Japanese encephalitis. Pig usually. Definitive host. Ardite birds like ducks, fowls and herons. Okay, please remember that. Sorry. Japanese encephalitis का vector Culex tritanio-rhynchus followed by Culex vishnui. Please remember this. ठीक है? Question number 130. A patient from rural village presented to the PSC with abnormal darkening of skin, that is pigmentation of skin along with fever. So pigmentation of skin is kala. Fever is jwar or azar. So it is a case of kala azar. Along with that, abdominal pain, swollen lymph node, that is lymphadenopathy, and massive splenomegaly. तीनों हो गए ना? Gaucher's disease, CML and kala azar. तीनों में massive होती है. With below given histopathology on spleen biopsy. Which of the following is the drug prescribed? So usually what are these spleen biopsy feature? Leishman, Donovan bodies, LD bodies. Donovan bodies का दिख रही थी? Donovanosis, that is granuloma inguinale. But LD or Leishman-Donovan bodies are seen in cases of Kala Azar, also known as visceral leishmaniasis, caused by Leishmania donovani, transmitted by sand fly. Which species? phlebotomous species, which is the test that we do, RK39 antigen test. Okay, important. What is the drug of choice? Liposomal amphotericin B. Important. इम्यूनिटी स्टेटस टेस्ट, जैसे टीबी के लिए मॉन्टॉक्स करते हो, डिप्थीरिया के लिए शिक टेस्ट करते हो, वैसे इसके लिए अलाजार के लिए यू गो फॉर अ मॉन्टे निग्रो टेस्ट, प्लीज रिमेंबर. Then cutaneous leishmaniasis is also known as oriental sore, Baghdad boil or Delhi boil caused by Leishmania tropica. Chalo. So what does the which of the following drugs should be prescribed? B or C? Answer should be B. The reason is, please remember, side effect of amphotericin B is nephrotoxicity. Which one is more nephrotoxic, liposomal or conventional? Conventional one. Therefore, we prefer the liposomal amphotericin B. Another previous year question: what is the most common side effect of liposomal amphotericin B? Recent question. It is not nephrotoxicity. Transfusion related reactions, please remember. Okay, so transfusion related reactions was the answer. It is the most common side effect associated with liposomal amphotericin B or even amphotericin B. Okay, and if treatment is not given adequately, after 2 years the patient will develop crops of nodules over the skin known as PKDL, post Kala-Azar dermal leishmaniasis. Question number 131. 26-year-old male presented with fever, chills, night sweats and diarrhea. Physician is suspecting malaria. Dipstick test was performed for the rapid diagnosis of Plasmodium falciparum. Why? Most common cause of malaria in India, whereas worldwide answer is Plasmodium falciparum. Only cause of complicated malaria or cerebral malaria. Again, Plasmodium falciparum. It is based on which protein? It is based on histidine-rich protein of Plasmodium falciparum. Shortest incubation period, Plasmodium falciparum. Longest incubation period, Plasmodium malariae. Relapse is common with Plasmodium vivax and Plasmodium ovale. Drug of choice for relapse prevention, Prima Quin. Very good. ठीक है. Drug of choice for malaria during pregnancy, single best answer, chloroquine usually. ठीक है. This are what? Banana shaped gametocytes seen in Plasmodium falciparum. Important. Then if the RBCs have single ring, it is usually Plasmodium vivax, but multiple rings within the RBCs, Plasmodium falciparum. Okay? Question number 132. A patient comes with a small clean wound on the knee, which is 10 by 2 centimeters, 12 hours old. He had taken TT 10 years back for another injury. What should be done? Easy. Assess the wound. It can be either a clean or a minor wound, or it can be any other type of wound. Puncture wound, okay, dirty wound, debrided wound, कुछ भी हो सकता है. So if it is a clean or a minor wound, तो मैं क्या देखना है? If the patient has taken the TT or the TD vaccine or not. If the patient does not know unknown immunization status or the patient has not taken the vaccine, give full vaccine schedule. कितने डोज? कितने डोज देते हो बे? 2 doses देते हो ना, तो 2 doses should be given, full vaccine schedule. If the TT or TD vaccine was taken, then you need to check if it was taken within 10 years or more than 10 years have passed. If, please remember, if it was taken usually within 10 years, then vaccine is not needed today because it is a clean or a minor wound. But if 10 years have already surpassed, then you need to administer vaccine today. Okay, so that has to be remembered. Please remember. You have to administer vaccine today, but kitna dose? 1 dose. That is which dose? Booster dose only. Next, if it is any other type of wound, you again need to see whether the patient has taken TT or TD vaccine or not. If the immunization status is unknown, usko nahi pata, ya fir the patient has not taken the vaccine, then administer the vaccine, but along with that also administer immunoglobulin because it is a other infected type of wound. इसीलिए clean minor होता तो only vaccine was required. Now you need to ask whether if he has taken the vaccine, you need to ask the vaccine was taken within 5 years or more than 5 years. If the vaccine was taken within 5 years, again, vaccine is not required today. But if the vaccine was taken more than 5 years ago, then we need to administer the booster dose today for sure. No issues with this. अपने patient में कौन सा wound है? Small clean wound, okay? And the vaccine was taken 10 years ago. So there was a small clean wound. He has taken the TD vaccine, but it has been taken 10 years ago, more than 10 years ago. Therefore, we need to administer one booster dose. So one dose of TT booster should be given. 133. A person from Delhi went to Assam for the trip and is now suffering from malaria for 4 days. He has now developed vomiting, altered sensorium, hallucinations. Blood smear test shows Plasmodium falciparum. What drug should be given? तो जिन्होंने ये देख के मार्क किया, बेटा ये देखना भूल गए क्या? Important is the malaria. Does it cause CNS manifestations usually? No. Malaria CNS में जाता है क्या? नहीं. ये complicated malaria का केस है. It is a case of cerebral or a complicated malaria which is caused by Plasmodium falciparum. 3 बार का repeat question है, यही वाला same. बच्चे वही गलती करते हैं हर बार. आसाम देख के आंसर नहीं मार्क करना होता, मैंने कितनी बार बताया. Altered sensorium and hallucination, seizures, all of these features are suggestive that the patient is having cerebral malaria. दिमाग खराब हुआ है उसका. और अगर दिमाग खराब हुआ है उसका तो definitely can we treat with oral drugs only? No, we have to start the patient on IV drug, and that will be IV artesunate has to be started in the patient. Okay, please remember, in northeastern parts of India, what should be given? Normal malaria, not a complicated, uncomplicated malaria की बात चले तो we will give RT mether plus lumifantrin. Me ज्यादा कहाँ होता है? वहां पे. Then rest other parts of India, we will give RT sunate plus sulfadoxine pyrimethamine combination. Okay. Pregnancy, jaldi se batao. Overall, it is chloroquine. But if they ask you for complicated malaria, first trimester it should be quinine, but second and third trimester it should be ACT, artemisinin based combination therapy, because ACT is only contraindicated during the first trimester, not in the second or third trimester. Okay. Question number 134. True about benefits given under the scheme launched by the institution. The following logo. कौन सा logo है? Yes, I see. Employee State Insurance Corporation. Usually इनके अंदर sickness benefit दिया जाता है. For how many days? 91 days. For a span of, no, sorry, on how many percent wages? On 70% of wages. Okay, so this is a wrong statement. Extended sickness benefit is given on 80% wages. For how many days usually? For 2 years, usually for chronic illnesses like tuberculosis. So this can be the right answer. Maternity benefit is given for a span of 6 months usually. Okay, so usually 6 months या फिर 26 weeks है. तुम बोलोगे सर almost similar है ना? 6 4 24, 26 थोड़ा सा अलग है, इसीलिए ये partially wrong statement हो जाता है. Okay, it can be a partially wrong statement. Okay, 26 weeks is the allowance which is given on 100% wages. तुम बोलोगे सर 6 months भी बोल सकते हैं, but logically सोचो 6 months मतलब 24 weeks, और कितना दिया जाता है, कितने हफ्ते? 26 हफ्ते. तो अगर देखना है तो ज्यादा करेक्ट आंसर कौन सा लग रहा है? ऑप्शन बी लग रहा है. तो आंसर शुड बी मार्क्ड एज ऑप्शन बी. फ्यूनरल एक्सपेंसेस गिवन आर 15,000 रुपीज. ठीक है. No issues with this. Direct medical benefit can be availed from the ESIC hospital, and indirect medical benefit can be availed by the registered medical practitioner or the empaneled hospitals under ESIC. That was a previous year question. हाँ बोलो. क्या क्या? पोस्टमार्टम ही आता है. हाँ पोस्टमार्टम भी आता है. Okay, important is how, sorry, how much percent wages are contributed by the employee? 0.75%. Employer 3.25% wages. Center is to state contribution is 7:1. A 25-year-old female was diagnosed with pulmonary TB and so was started on anti-tubercular therapy under National TB Elimination Program. She was taking oral contraceptive pills for contraception, but the doctor advises to add on condoms for additional protection. What is the underlying cause? Rifampicin. It was a part of GPRS cell phone. So it is an enzyme inducer or it is an enzyme inhibitor? It is an enzyme inducer. And enzyme inducers will metabolize the other drugs faster or slower? Faster. So it will excrete out the drug faster. Because it is activating the enzyme, drug will be metabolized faster. It will be immediately kicked out of the body. So it will cause drug failure or drug toxicity. So usually कौन से drugs ले रही है patient? OCPs. उसका failure हो जाएगा if the patient is started on rifampicin. That's the reason why doctor advises कि भाई बेहतर है you also start using condoms. That will provide an additional protection because rifampicin is known to induce enzymes causing OCP failure. So rifampicin induces OCP metabolism causing OCP failure. No issues with this. याद रखना rifampicin is an enzyme inducer. Therefore, it activates the enzymes. Therefore, the enzymes will metabolize the oral contraceptive pills faster. Therefore, the OCPs will not stay inside the body for a longer period of time, and that will cause drug failure. That's how simple it is. Question number 136. After a flood in the state of Orissa, the district health authorities distributed doxycycline and chemical poison spray. Identify the chemical. Usually in a flood region, after a flood, okay, definitely after flood, definitely which among the following diseases will have the highest risk? मैंने क्या बोला ये एग्जामिनर का टॉप मोस्ट फेवरेट है तुम अभी भी उसको छोड़ के ही चल रहे हो यू हैव नेवर स्टडीड दिस डिसीज इट इज लेप्टोस्पाइरोसिस लेप्टोस्पाइरा एंट्रोगन्स फ्लड की क्लासिक हिस्ट्री देते हैं वो फ्लड की क्लासिक हिस्ट्री व्हाई बिकॉज जैसे फ्लड होगा पूरे के पूरे चूहे कहाँ आएंगे बाहर and all that water will contain the rat urine. When you come in contact with the rat urine, you will get infected with Leptospira interrogans, which is a bacteria, and you will suffer from leptospirosis usually. Okay, so usually they will give a history of water sport, fishing, bathing, swimming, rice farming. Along with that, they can give history of farming, hunting, butchering, okay, or contact with animals. Most important, history of floods. वो कभी भी नहीं गई है तुम्हारे एग्जाम से हमेशा they give history of floods. Okay, contact with rat urine is the known cause of leptospirosis. So doxycycline is definitely given for chemoprophylaxis of malaria, but it is also given for chemoprophylaxis of leptospirosis as well. Whereas the chemicals poison spray which is given over here is known as zinc phosphide because lindane, Paris green, and malathion for mosquitoes. Paris green, which is there, it is a stomach poison. All are nerve या contact poison. Important is malathion spray. If you are a medical officer, previous year question, कितनी frequency होनी चाहिए malathion spray की? Once every, अरे previous year question है ना? Once every 3 months should be sprayed. Question number 137. A patient with morning stiffness of joints and investigations revealed that the patient is suffering from rheumatoid arthritis. So the physician is thinking to start a DMARD, that is disease modifying anti-rheumatoid drug, which are the drug of choice for RA. Regular monitoring of visual acuity and fundus examination is required when the patient is being treated with the following DMARD. DMARD of choice during RA is methotrexate, but methotrexate does not cause any visual problems. It is hydroxychloroquine, which is known to cause bull's eye maculopathy. Okay, so hydroxychloroquine is known to cause bull's eye maculopathy, okay, which is a visual acuity defect, and that's the reason why patient needs. Okay, patient definitely needs. This is the bull's eye maculopathy. Okay. So the patient will lose his central vision usually. Therefore, the patient needs to undergo regular visual monitoring. Okay? Question number 138. Hydroxychloroquine is the DMARD of choice for rheumatoid arthritis during pregnancy. Otherwise, it is methotrexate. Question number 138. A patient presents with fever, abdominal pain, and watery diarrhea. Lab investigation shows WBC count of 15,000 cells per microliter. The patient gives history of being treated with clindamycin for an episode of cellulitis. What is the drug of choice for this patient? Provisional diagnosis, fat say. Provisional diagnosis. Shabash. It is a case of pseudomembranous colitis because now the patient is having signs and symptoms of colitis, that is watery diarrhea, abdominal pain, and fever. But he gives a history of intake of a broad spectrum antibiotic. Most common antibiotic responsible is third generation cephalosporin, followed by clindamycin. Due to this, the normal bacterial flora is suppressed and the pathogenic flora is increased. Which is that most common organism? Clostridium difficile. It releases a lot of toxins, which leads to pseudomembranous colitis in the patient. What is the drug of choice for pseudomembranous colitis? The only indication is oral. Only oral indication of vancomycin is pseudomembranous colitis. Baki har jagah it is an injectable drug. Which side effect it causes? Red man syndrome. Grey baby syndrome is seen with chloramphenicol, and blue baby syndrome is seen with amiodarone. No issues with this, anybody? Important. Staph aureus के लिए drug of choice बताओ फट से. Staph aureus drug of choice. Methicillin. If methicillin resistant staph aureus is there, MRSA के लिए drug of choice. Vancomycin. But if the patient is VRSA, vancomycin resistant staph aureus, then it is daptomycin. But daptomycin is not effective in cases of VRSA pneumonia. वर्षा निमोनिया के लिए ड्रग ऑफ चॉइसेस लिनेजोलिड. ठीक है. Question number 139. A HIV positive patient develops abdominal TB and was started on anti-tubercular therapy but does not respond. So gene expert analysis was performed which shows resistance to isoniazid and rifampicin. यहाँ तक तो ये क्या हो गया? Multi-drug resistant TB. Plus there is also resistance to kanamycin, that is second line injectable drug, along with levofloxacin, which is a fluoroquinolone. What is the likely diagnosis? XDR-TB. Extensively or extremely? It is extensively drug-resistant TB. The drugs used for XDR-TB, anybody? Where a question is bedaquiline, and another drug is delamanid. ये bedaquiline वाला question आ चुका है. New drug used for treatment of XDR-TB. Answer is bedaquiline. What is the investigation used to see or check resistance? Rifampicin resistance can be known with the help of this LPA, that is line probe assay. It can tell you better about all the drug resistance together. Okay? Then question number 140. A 45-year-old woman suffering from type 2 diabetes mellitus presents with complaints of dysuria, that is painful micturition, along with burning micturition. Which oral hypoglycemic drug should have been avoided? Very good. What is the drug of choice for type 2 diabetes mellitus? Metformin. Metformin belongs to which group? Biguanides. What is the side effect of biguanides? Lactic acidosis and vitamin B12 deficiency causing megaloblastic anemia. Metformin is not preferred in patients suffering from chronic kidney disease because it is excreted via kidneys itself. Drug of choice for type 1 diabetes mellitus? Insulin. Shortest acting insulin? Lispro, aspart, glulicin. Sorry. Longest acting insulin? Degludec. Half-life more than 42 hours. Followed by Detemir or Glargine. Okay, important. Which is the only insulin which can be given via intravenous route? Regular. All others are given via subcutaneous route. No issues with this. Now, usually a drug which is known to cause glucoseuria. What is glucoseuria? Excretion of glucose inside the urine. Q. Because the reabsorption of glucose from kidneys will be inhibited. Reabsorption of glucose via kidneys is done by SGLT2 receptor. So SGLT2 inhibitors are drugs like gliflozins, that is empagliflozin, canagliflozin, dapagliflozin. So if reabsorption is not occurring, all that glucose will be excreted out in urine. That causes glucose urea. More amount of glucose in urine will increase the risk of bacterial infection, increase the risk of UTI. Already patient is having UTI. Okay, so that's the reason empagliflozin should have been avoided, because the side effect with empagliflozin or any other SGLT2 inhibitors is UTIs. Please remember. All gliptins are what? Gliptins are DPP4 inhibitors, dipeptidyl peptidase 4 inhibitors. All DPP4 inhibitors are contraindicated in renal failure except linagliptin. Only gliptin which is safe to be given in renal failure. Answer is linagliptin. Okay, glibenclamide, glipizide, gliclazide. These are sulfonyl ureas. Maximum risk of hypoglycemia is seen with insulin, followed by sulfonyl ureas. That is glibenclamide, gliclazide, and glipizide. No issues with this. Question number 141. With respect to clinical trials, which of the following is most correct? Clinical trials के कितने phase हो चुके हैं अभी? 5. Okay, preclinical trials are carried out on animals, but clinical trials are carried out on humans. 5 phases. Phase 0 is known as micro dosing. How much dose is given? Only 1/10 of the dose. Phase 1 is carried out on healthy human volunteers. It is done for safety, non-toxicity of a drug and maximum tolerable dose pata lage. Then phase 2 is carried out on patient. So after which phase patients are taken into the clinical trials? Phase 2 के बाद usually. ठीक है? तो patients are taken into the clinical trial. Phase 2 में क्या करते हो? You will determine the efficacy. तुम्हारी ड्रग अच्छी है या नहीं है? Phase 3 में क्या करते हो? RCT, randomized controlled trial. That means you will compare it your new drug with the existing drug in the market. After phase 3, you will launch the drug in the market, and then starts the phase 4, which is the longest phase of the clinical trial, also known as post-marketing surveillance, which is done for long-term and rare side effects of the drug. Maximum chances of failure are seen in phase 2 usually. Most important phase of clinical trial is phase 3 because RCT is carried out in phase 3 usually. Okay? Chalo. So phase 1 involves healthy volunteers. That's a true statement, definitely. Phase 2 involves use of new drug in large number of patients. No, less number of patients. Phase 3 involves large number of patients. Phase 3 involves determination of therapeutic index of a drug. Therapeutic index tells you about safety of a drug, and safety of a drug is assessed in phase 1 of the drug. Phase 2 में बच्चों अपन efficacy determine करते हैं, safety नहीं. Safety, non-toxicity, maximum tolerable dose तीनों phase 1 में होते हैं. ठीक है? Then phase 4 involves the detailed study of toxic effects. No, it is not the detailed study of toxic effect. It is only the long term and the rare side effects which will occur. Question 142. We'll do 150 and then we'll call up the session. A 55-year-old patient comes with palpitations and headache. On examination, blood pressure was 170 by 90 millimeter of mercury. That means the patient was having hypertension. Heart rate is 98 beats per minute, tachycardia. Respiratory rate is around 12 breaths per minute. On history taking, he takes insulin for diabetes and he has 2 hypoglycemic attacks prior. Which of the following drug is better to be avoided? Which drug has to be avoided? As he is having hypertension, we need to give some antihypertensive drug. But which antihypertensive drug should not be started in this patient? Beta blocker. Why? Because he is taking insulin and insulin has maximum risk of hypoglycemia. And 2 hypoglycemic attacks already. So if you give it, beta blockers cause what? Beta blockers, like anything like metoprolol, will cause it causes masking of warning symptoms of hypoglycemia like tachycardia, palpitations, diaphoresis. They will not be seen if beta blockers are given to the patient. That's the reason why patient will die of hypoglycemia. You will not even know. So better to avoid beta blockers in a patient of diabetes mellitus. No issues with this. A patient of diabetes mellitus having hypertension, drug of choices. Very good. ACE inhibitors, drugs like pills, that is captopril, lisinopril, or enalapril. The side effect of ACE inhibitors are dry cough and lip swelling known as angioedema due to increased levels of bradykinin. सरकारी question तुम्हारे एग्जाम का. ठीक है? Sartans are nothing but angiotensin receptor blockers. They do not cause these 2 side effects. ठीक है? Question number 143. A 30-year-old female presents with severe unilateral pulsatile headache. She had such episode 3 to 4 times since the last year. All investigations were found to be normal. The doctor prescribes a newly approved drug that acts by stimulating the 5-HT1F receptors. The likely drug is. Provisional diagnosis is migraine. Migraine के लिए diagnostic criteria is pound criteria. P stands for pulsatile headache. O stands for 1-day illness. Usually the attacks of migraine will subside in a span of 24 hours. U stands for unilateral headache. N stands for associated with nausea and vomiting. Sometimes even with phonophobia and photophobia. Irritation to light and sound. D for disabling in character. Patient कोई काम नहीं कर पाती है. Usually it is a young female who is commonly affected. What is the cause? It is the CGLP release. This calcitonin gene-related peptide causes vasodilatation of the meningeal vessels. That causes irritation of the meninges and that leads to migraine in the patient. Therefore, we can give CGRP release inhibitors. Drugs like triptans, 5-HT1B, 1D agonist usually. Okay? Or we can also give 5-HT 1F agonist, drugs like ditans, lasmi, ditan. Okay? No issues with this. Monoclonal antibodies which have been started in migraine nowadays. नाम याद रख लेना कम से कम. Usually galcanezumab and erenumab. Okay, so these are the monoclonal antibodies given in cases of migraine. Okay, galcanezumab and erenumab usually. Olcigepant is also given in cases of migraine itself. And if I say sung, usually it is a male and who is having sung feature. What is sung? Short lasting, unilateral headache, nausea and vomiting, conjunctival redness or redness of eyes, along with tearing or lacrimation from eyes. Very good. Short lasting, very short lasting. That means short, even for a span of 15 minutes to 3 hours maximum, one episode, and multiple episodes in a single day. Very good. It is a case of cluster headache. What is the drug of choice for cluster headache? Very good. First is high flow oxygen along with sumatriptan. What is the drug of choice for prophylaxis? Calcium channel blocker known as verapamil. Question number 144. A patient was brought to the emergency department who was unconscious, non-responsive to pain, and pinpoint pupils were noted. Respiratory rate is 10 breaths per minute. That means respiratory rate is low. There is a respiratory compromise. And his friends give history of chronic substance abuse in him. Which among the following drugs will be used in managing his condition? What is the cause? Opioid toxicity, right? It is a case of opioid toxicity. Usually opioids like morphine, heroin, anything, they cause classical features known as sacrum. S stands for sedation, so jata hai patient. A stands for analgesia or pain relief. C stands for constipation. R stands for respiratory depression. That means the respiratory rate goes down. U stands for euphoria. बिना reason के खुश हो जा रहे. ठीक है. M stands for meiosis usually. Pinpoint pupils. So this is the classical features of opioid toxicity. The drug of choice for opioid toxicity in emergency is definitely naloxone, which is given via intravenous route. For maintenance phase, what is the drug of choice? Maintenance phase के लिए the drug of choice is methadone. And for relapse prevention, what is the drug of choice? Naltrexone. Chlordiazepoxide is the drug of choice for chlordiazepoxide is the drug of choice for alcohol withdrawal usually. Please remember. N-acetylcysteine is the antidote of choice for PCM toxicity. Question number 145. A 30-year-old male patient presents with multiple petechiae, small bleeding spots all over the body, and there are bleeding episodes also. He is having no history of any infection or autoimmune disease. His CBC reveals low platelet count, that is thrombocytopenia. Among which of the following drug will be prescribed to the patient to increase the platelet count? To increase the platelet count, which is the interleukin which will stimulate the platelet? Shabash, interleukin 11. An interleukin 11 activator is a drug known as oprelvekin. 11 याद रख लो, 11 ऐसे करके. ठीक है, तो oprelvekin is interleukin 11 stimulator which causes thrombocytopoiesis, that is increased platelet synthesis. Filgrastim is usually given in cases of filgrastim, granulocyte stimulating factor, usually when there is neutropenia in the patient. When there is neutropenia in the patient. Okay? Whereas, so it is granulocyte colony stimulating factor. Sargramostim, it is granulocyte monocyte colony stimulating factor. And that is usually given in cases of granulocyte as well as monocyte deficiency in the patient. कब होती है usually ये सब चीजें कब होंगी? Chemotherapy. Very good. Chemotherapy drugs are known to cause, definitely. Chemotherapy drugs are definitely known to cause uh, bone marrow suppression, and that bone marrow suppression can lead to thrombocytopenia, leukopenia, and anemia in the patient as well. Please remember that. In that condition, we will give filgrastim, sargramostim, or oprelvekin. Romiplostim can also be given, which will also activate the platelets. But important is It is not preferred in chemotherapy induced wala case. Okay? Next, question number 146. Patient is a 22-year-old woman with several episodes of bloody diarrhea. She is HIV antibody positive with a CD4 count of 50. Stool cultures for Shigella, Salmonella, Campylobacter were negative. An assay for Clostridium difficile toxin was also negative. Colonoscopy revealed many ulcerated lesions. Biopsy reveals aula inclusions in the nucleus. Which one of the following is the most likely cause? Answer is option B, that is cytomegalovirus. देखते ही पागल हो गए बिल्कुल. Important is HIV, human immunodeficiency virus causes AIDS. Usually, it decreases the CD4 cells. Opportunistic infection occurs more commonly when the CD4 count is less than 500. Most common opportunistic infection in HIV positive patient. Pneumocystis jirovecii pneumonia. Most common opportunistic infection in HIV positive patient in India. Answer is tuberculosis. No issues with this, anybody? Please remember, if the CD4 count is between 200 to 500, ये important है, ये याद रख लेना. The patient can have important risk of pulmonary TB. This is most common in India. Please remember. The patient will also have risk of oral candidiasis, also known as oral thrush. The patient will have high risk of oral hairy leukoplegia, even high risk of herpes zoster. Bacterial pneumonia is most important. Kaposi sarcoma, because it is a skin cancer associated with AIDS positive or HIV positive patient. Please remember, CD4 count less than 200. It leads to esophageal candidiasis. Most important you need to remember is toxoplasmosis, then cryptococcosis, that is cryptococcal meningitis it can lead to, and pneumocystis jirovecii pneumonia, which is the most common opportunistic infection worldwide. CD4 count below 50, it was known to cause disseminated Mycobacterium avium complex along with CMV, that is cytomegalovirus. Either it will cause diarrhea or it usually causes retinitis in the patient at a CD4 count less than 50. ART, antiretroviral therapy for HIV positive patients, should be initiated at what CD4 count? There is no CD4 cutoff for starting. Sorry. The antiretroviral therapy. Epstein-Barr virus is human herpes virus type 4 associated with जल्दी से कौन सा lymphoma? Hodgkin's lymphoma, non-Hodgkin's lymphoma, Burkitt's lymphoma, कौन सा carcinoma? Nasopharyngeal carcinoma and post-transplantation lymphoma, past diseases. ठीक है, so that's past cancers important. No issues with this, anybody? Human herpes virus 8 leads to Kaposi sarcoma, which is commonly associated with AIDS patient usually. Most common cancer associated in AIDS patient, non-Hodgkin's lymphoma. That is diffuse large B-cell lymphoma, followed by Kaposi sarcoma. ठीक है? तो गलतियां मत कर देना. And Cryptosporidium parvum causes diarrhea in the patient. We have discussed. A teacher recently joined school in the village and few days later developed rice watery stools. The toxin produced by the organism acts on which of the following receptors to produce the action? What is the rice watery stool wala diarrhea? Cholera. And the cholera toxin binds to which receptors? Sarkari question. GM1 ganglioside receptors usually. And then it causes diarrhea in the patient. ये बहुत common question है. 2 बार FMG, 1 बार NEET-PG and recent NEET-PG 2023 का question है ये वापस. ठीक है? That's important. Question number 148. A previously well 35-year-old man presented with high-grade fever, severe body ache, headache, and rigors for 4 days duration. NS1 antigen, rapid malarial test, and blood cultures all were negative. Peripheral blood smear shows microfilariae with 2 nuclei in the tail tip. Okay. What is the etiologic agent? Now, please remember, if they are saying microfilariae which is collected from blood sample, we need to see the tail tip. If the tail tip has no nuclei, answer is Wuchereria bancrofti, which is known to cause Bancroftian or lymphatic filariasis. The transmitting agent is Culex. Which one? Culex quincke fasciatus, known as Culex fatigans as well. The investigation of choice is DEC provocative test. Okay. Whereas if the tail tip shows 2 terminal nuclei, then the causative agent is Brugia malai. Okay. It causes Brugian filariasis, and vector is this mosquito. Vector is the Mansonia mosquito. Important is lymphatic filariasis causes hydrocele and elephantiasis in the patient. Drug of choice for both of them is DEC, that is diethyl carbamazine. Please remember that. Usually, previous year question, microfilaria in cases of filariasis are not present in which secretion of the body? Saliva. Please remember, these filariae will never infect the salivary glands. Therefore, it will never be present in the saliva. It can be present in urine, semen, blood, everywhere except saliva. Okay? And test is usually blood sample is collected at what time? Night time, 8:30 p.m. to 12 a.m. because they are nocturnal in habitat. Triple therapy given for elimination of lymphatic filariasis from India. Diethyl carbamazine plus ivermectin plus albendazole. Please remember this. Important if filariasis. Okay, so here the causative agent is Brugia malai because two nuclei are seen in the tail tip. 149. A nurse was taking blood sample. Sarkari question. And from a patient admitted in ward, and accidentally she spilled the blood on the floor. Which among the following will be used as a disinfecting agent for the blood spills? It is the 1% sodium hypochlorite. It is also used as a disinfecting agent for HIV infected materials. Yes, for HIV infected materials also we will use 1% sodium hypochlorite. 2% glutaraldehyde is also known as Sidex, and it is used for cleaning or disinfection of scopes, all scopes, okay, endoscopes, colonoscope, cystoscope, everything. Isopropyl alcohol is used for cleaning of stethoscope and the thermometer usually. Formaldehyde gas is used for fumigation of OT, operation theater. Last question for today. A child has been brought with history of abdominal cramps and diarrhea along with fatigue and pallor. That is anemia bhi hai bachon mein. Parents give history of perianal pruritus and stool isolation reveals the below given helminthic egg. What is the egg? Egg is having blastomeres in it. What is the likely causative agent? So the egg with blastomere causing iron deficiency anemia due to blood sucking worms is nothing else but Ankylostoma duodenale. We have discussed about the rest of it. Okay? So that was all about today. Thank you so much. And we'll be informing about the next session if I get time. So we'll be accordingly deciding about it. Okay?